Well, như chúng có phân số tuổi tôi tổng Lo-Pha Society cho học theo những ngôi Yaig workshop cho nó. We Lo-Pha Society là the chairman, cũng về nông nghiệp Hmong, cụ thể cụ trình thì nó bên mua cụ tôi một chain, bên từ PR, bên mua từ Lo-Pha Ball, bên từ fundraising chair, tôi thank you, bên từ secretary. Jerry, a bit treasurer, que mesmo Senegal, a bit to event coordinator, he got a que Chichu, no, the Lo-Pha chain, a bit the vice chair. Yeah, so this is the team, and this is one of many of our workshops that we want to provide to the community. We shall share the nation of China. Còn đây còn nó nói còn đạo yêu cầu của trường học đã only way I have to know. Hopefully you guys come and support our future workshops to come. So we still have a couple more that is still being developed, and it'll be much like this one as well. So 우리 다음에 저 배웠던 게 그거는 그리고 차 그들의 나게 수사했잖아. Then you so graduate a thought of a DMP, so mental health nurse. So he just did his commencement this week, but he's been practicing mental health for quite a few years now as well, and he's had experience with social work and mental health patients in the past. 지금 이렇게 뭐 bây this week we do someone thì do 진행 chuyển to a public justice department trong mental health department. So more experience so way to counselor to yeah. 뭐 저희 우리한테 고마 군해랑 그 주주님 팀에서 built a workshop on discussion. We're going to do a presentation, so we will open up to discussion. Feel free to come and with your questions and talk with us and share with us your thoughts and your questions too. Built a workshop also. We share some of the key without further ado, we'll go to you.
Okay, we are Chan Lo. Glad to be here, and I'm glad to see everyone here. One day we pick up presentation on. I think we may use mostly English, right? Just so that we can fit everything. More not only that, but it makes me less embarrassed because my voice is perfect. But yeah, and just. Okay, so again, I'm Char. I currently work at Hmong County Medical Center right now in the outpatient mental health clinic, the adult psychiatry unit. Right there we see very severe, persistent mental health individuals. We see about 5,000 folks in the metropolitan area. The sickest mental health people come to us for care. And I'm part of that team as the first line to help them get established, help them get their medications, and all of the mental health concern.
Hey, hello everyone. I'm sorry. Hello everyone. Lúc này hội trong mùa lo, ở gia đình thì lúc này trong mùa là gì? Mùa hôm mình cái gì bỏ rồi na. My English name is Choose Lord. I'm a mental health crisis social worker. I work with Carver County for the past 3 years. I just got transitioned to Washington County. Started my first day, and sorry everyone, I'm wearing a sunglass because I have a scooter accident and my eye looked pretty bad, so I'm wearing a sunglass, so I'm sorry everyone. So yeah, I started over at Washington County they call us differently. When we're at Carver County, we call it crisis team only, but when I'm at Washington County, they call it CRU now. crisis responding unit. So I'm a social worker responding to crisis. And crisis, my favorite much more. Local crisis, that you know, you was up, tight, you get line. That should be crisis, not everything, right? Need mental health, struggle, lawyer, something that's not emergency but urgent enough, right? And that you need someone to respond to help you or anything. And I do, like you said, when I was at Cover County, I was able to be one of the persons who actually developed their embedded social worker position over there, and I work in the dispatcher, responding to a lot of mental health calls coming to dispatch for Cover County too. So yeah.
Okay, so let's get this presentation started. We should, Alright, this is called the Mental Health and the one presentation. This is just going to be a very general introduction. We want to know if you get questions, feel free to interrupt and just ask away. Alright? So to start off with, mental health. Mental health is when we consider the person's overall emotional, psychological, and social well-being. So it covers how people think, how they feel, how they act in response to the challenging things in our life, the stressful things in our life. And when we think about emotional health, that's the state of well-being related to one's emotions, their thoughts, and behaviors. When we think of psychological health, those are concepts that refer to how a person thinks, how they feel, how they behave. Psychological health is a deep outlook at the reasons for a person's mental experiences. And then social well-being, the state of positive social interactions and a sense of belonging, of community like what we have here today, the relationships that we have, the social support and involvement in social activities. So kind of going a little bit more, managing our emotions in a healthy way, such as coping with stress, expressing feelings appropriately, and bouncing back from those setbacks. Those are big pieces of our emotional mental health. We want to build and nurture supportive relationships with others. Emotional stress can contribute to physical problems. The most simple things like headaches, fatigues, and insomnia. That means that you just can't sleep, you have a hard time, whether it be no hours of sleep, or just a few hours of broken sleep at night. And then psychological health. Again, how a person thinks and feels and behaves. So these are serious. This can lead into serious conditions that can affect a person's thinking, their mood, and their behavior. It can be occasional or long-lasting. Sometimes they call it acute and chronic. Right? Acute is very sudden, right at that moment. And then chronic is long-lasting over several years, several months. And then it can affect a person's ability to relate to others and how they function on a day-to-day basis. How does a person cope with stress? All right, so how do we cope with stress as people? That's a vital part of life, from when we're born up until our adulthood, up until our late ages in life. So the understanding of mechanisms, patterns, and processes that drive thoughts and behaviors of oneself, that's the biggest piece of the psychological health. And everyone has this. It's a piece of us just being human. And social well-being, strong social connections, having close, supportive, and trusting relationships with family, friends, and community members, that sense of belonging, feeling accepted, valued, and part of the group and community. Having those positive social interactions, engaging in meaningful and enjoyable social activities such as participating in hobbies, volunteering, and attending social events. Those are crucial in just this overall holistic part of our mental health and well-being. And the social contribution, feeling a sense of purpose and making positive contributions to society. That's a big thing with no leaders here. I mean, you can talk to the president of Lo-Pha in our area here, making a difference in testing those numbers. Social skills, being able to effectively communicate, build relationships, and resolve conflicts. And so when we think of what is mental health, when these emotional states, the psychological states, the social states, when they are in disarray or when they're not balanced, that's when our mental health becomes challenging. And so we want to make sure that we find that balance so that we can stay on top of it, stay healthy. So, next pieces we're going to talk about are just common mental health disorders. A lot of these are just questions that I go a little with patients.
Yeah, so you talked a lot about all the different types of mental health and how we can get affected. You briefly touched on balance. Well, what are some ways that we can find balance across our mental health, given what you were talking about?
Okay, so let me ask, what are some ways that we can find balance in our mental health? First piece of that is kind of just reflecting on yourselves and reflecting on what part is missing. Say, for example, work, right? Maybe you lost your job. Maybe then that's the time that you have to look into like a job counselor to see if they can help you out. Try to reach out to some of those resources. Say that it's the mental health crisis piece that's out of whack. That's when you reach out to counselors, therapists. If you don't know where to reach out first, I always say reach out to the primary care doctor. And primary care doctor, they'll be able to kind of lead you to those resources that are needed. That's always helpful. And especially if you feel like, I can't go to family. I don't know if family is like the right choice to go to. Reach out to those people, those professionals that you do know.
Or especially if you don't know, every county, my voice is loud. Every county have a crisis team. So you can look up Hennepin County, Anoka County, Washington County, Scott County, or whatever. In the United States, it's after, law? Travis law. The United States, every county has to have a crisis team, or else they have to contract it out. So that's by law, it's a federal law. It was about 6 years ago that happened. So crisis line is a hotline that you can call, and that city or that county, and they do have a national line too, which is 988, right? The label of the name is a little harsh, but it's actually the hotline. 988 yellow was national suicide line hotline, right? Which is suicide at the same time you have mental health there. When come on any health concern or anything concerned, because I know that you can call 988, someone will answer you 24 hours, 7 days. A week, any 365. So they have someone there to help give you resource or pass you to a correct person. Or they're gonna loop you back to your county crisis team, and there will be a social worker or a person like me responding. If you're having a crisis, will come up to you and talk to you, or do a mental health assessment, or refer you to the best possible.
So, those are like the idea.
So you could stay anonymous. All the suicide line and all the crisis line are you don't have to give your name at all. You can stay anonymous, and everything are whatever you said, stay with them. They don't have to share with anyone else, and it's by law to protect you in your identity. So you can just give your name or give someone's name or whatever, but it's up to you. But once they respond to your house, then they will want your name or everything you need you. So to use that money. Yeah, and the confidential control everything. But you more right to share. They will stay with them down if you want. But you want that share, they only stay or if you are a person that you call, right? We call it regular caller. You have paid for them, but they pay for second. Các thầy cô mình sẽ biết bao giờ cái góc số bị chạy. Whatever you leave off, we can start right there and move forward. Try to guide you through that. But other than that, they're not going to use your name to bills. They're not going to use your name to court or law or anything unless there's a lawsuit come through the county, you sue the county or whatever, then that they will have to subpoena the issue. I think that's enough.
So common mental health disorders, anxiety disorder, Hmong, gay, mood disorders, these are like depression, bipolar, this is a disorder that's probably not familiar to other people. We may use that very commonly in our language, as they call it. We see somebody lashing out, they seem very different from themselves, and we do have that common term, just like, oh, that person's so bipolar. You know, bipolar in the mental health world is a little different, and we'll talk about that a little bit more. But psychotic disorders, so when you think of mental health and you're thinking crazy, you're thinking of these disorders, the psychotic, at least schizophrenia, delusions, psychosis, and again, we'll talk about that in a bit more detail. And eating disorders, substance use disorders, and then trauma-related disorders, gay, what's it, gay, I'm trying to figure out.
Hold on, you go one side, you're going to keep more on the side, don't have the trauma. You actually, because long we got trauma and not. In my field and child's field are totally different, right? And then, yes, field, trauma is totally different too, because trauma, go, don't law, go to the home law. No, you have head trauma, which is different. But trauma, not the thing, you have to do your body, you get that, you know, you think we're trying to go and move on. But you knew a whole lot of that long trauma, you don't get there. So that's a really big word.
So symptoms are what we're presenting with, right? So the mood, the anxiety, the sleep, the appetite, the thought perception, how we're perceiving our thoughts, how we're seeing it, the guilt, shames, people may feel shameful. So when we say mood, we're asking and we're questioning people, we're saying, okay, how do you feel? How does everyone feel today? You guys wake up on a good side of the bed? All right. So Nomi, how did you feel today? Tired. Well, how do you feel, right? I mean, tired is like your physical self. So when you want to ask about emotions, you want to ask, like, do you feel sad? Do you feel like in the last couple of weeks your mood has been down, or you just feel like, oh, I don't know, I'm just not as 100%. That tired and exhausted is probably contributing to it.
And I want to add more to travel perspective, especially where in our Hmong community, there are a lot of cultural clash and cultural value. We really say to them, are you? Come here, help. That's it, right? But we do it in John Luke Kilo. They go with Yaig. But we, and mental health perspective, this is a different approach, right? So I think I don't know what type of things are make here, everyone get from my awareness and learn how to see yourself, reflect on yourself, and how to approach. Because everyone has mental health, even me. Such you thought that the word normal, it's never normal. Normal is a person who knows how to manage it, control yourself, manage yourself. But you might not know what the normal is. So everyone have a piece of mental health that go through a lot of hardship, right? So at the same time, it's how you approach. Then you go to the child, I want to no to be that hard you tired. And mental health field or professional been asked that way, and elaborate more. They do the ask them, but they get avoid any question or the more put it into what we call it I message instead of you message, right? Create that comfort zone to have you open more. For example, like, how are you feeling? So you say, I'm tired. What make you so tired? What's going on? Tell me about it. He is obligated to listen more and open up more. Tell me about it, right? With that short little word, bé khôngอยากจะไปลองดูไปที่นู่นนะกับไปที่ไปลองดูนะอย่าไปลงตรงเล่นหนึ่งเทียนต่อไปลองจับ especially มันจะเข้าเกียร์กินมันตามไม่สถานเลยถ้าเกี่ยวไปบอกไปตัวเข่งจะไปบอกเนาะ biết kỹ cử biết cho kỹ xã biết cho kỹ tàu bây giờ tiếng kỹ tàu giả là biết xã tàu biết vẽ kỹ tàu hay tàu đó đó chỉ giả là nông với nó còn tàu vẽ kỹ nó phát trong đá cho kỹ tàu biết kỹ tàu có kỹ tàu có kỹ tàu có bát có kỹ thì họ lấy họ về nơi có bát có kỹ tàu có ép có bát. Sorry, I just want to elaborate more on that.
Feel free to chime in. All right, so common moods, depression, or depressed, irritable, right? Elevated is like you're full of energy. Mixed means that, oh, sometimes you're sad, sometimes you're very elevated, it bounces back and forth. So when we're thinking about anxiety, we ask ourselves, are you a warrior? So what do you typically worry about? So that could be things that you are fearful of, could be like your next exam, could be your test, could be that, oh, I'm concerned about my mom and dad's health, anything like that. Those are all part of this anxiety picture. Sometimes those thoughts, they race. When they say racing thoughts, it's like ongoing, it doesn't stop. Those are racing thoughts. Intrusive thoughts. Those are when those thoughts kind of just pop in your mind, whether you like it or not, it just shows up. Concerns about people judging you. Like, oh, I've got a lot of social anxiety. For me personally, I had a lot of social anxiety when I was growing up. So this is a big piece of me, right? So we're concerned about our self-perception. We're concerned about how other people see us, and so that in itself makes us anxious. Even just being up here. I'm glad it's family, friends, we're coming. So fear of objects, places, animals, situations. I hate spiders. I don't know what you guys hate. My girls hate them even more, and I got to be the big one to kind of take over that anxiety and take care of that. Physical symptoms. A lot of this anxiety can also result in physical symptoms. Shortness of breath, like you're coughing. Or you feel like, oh, my chest is just hurting. I've got this sharp pain. Sometimes people think that they're going to have a heart attack just because of anxiety. So they go to the emergency room and they're like, no, you guys, you're just having a panic attack, right? And then your heart is racing. It's going over 100, 120, 140, you can't stop. Tremors, you're just kind of shaking. That's a tremor. Irritability, where everything that you do, it just kind of gets on your nerves. Headaches, muscle tension, you feel like your neck is like always tense, your shoulders always tense. That's when we're feeling anxious. All right, and then sleep. How are you sleeping? You said, oh, I'm tired. Yeah, you're sleeping good. Coach says he barely gets any sleep these days. And so, is it hard to fall asleep? Is it hard to initiate or start that sleep? And if you do start that sleep, do you sleep through the night? Are you waking up? And when you do wake up, how easy is it to fall back to sleep? Are you having nightmares? Some of these can be going back to the trauma, like and so a lot of this is connected.
And add on to this, sleep is actually a double-edged sword. What I mean by double-edged sword is that too much sleep is not good, right? No sleep is not good because your body is actually good. Currently, they're going to get you short. But when currently they're going to get you short, it's called what you got to put it up in your own job. But you got to put it on your own that's not good too. Because that's why I said sleep is a double-edged sword. There are balance of sleep. Everywhere said 8 hours a day, 12 per sleep. But a lot of us professionals don't get that, but 6 is good enough, right? But mostly it's 8. So 8 hours, if you sleep too much, another can be depressed too. So sleeping is a double-edged sword.
Yeah, when it's interfering with your daily life, that's when the issue. That's when it's the issue. So appetite, we don't think too much about what we eat and how it affects our mental health. It's a big picture. What you put in yourself, it affects your mind and your body overall. TPS, I think we can definitely speak of that a lot more. So, what is your appetite been like? Have you been eating 2-3 meals a day? These days, we try to follow the social norms. You're like, yeah, I gotta go fast. I gotta not eat 12, 18 hours and then start eating. Well, you gotta make sure that you're getting adequate nutrition too. And if you're not getting adequate nutrition, you're not feeding that brain. That's when it's gonna lead into those emotional, psychological issues. So Is your appetite increased, decreased? Are you restricting food? This is going into the eating disorders. Are you restricting food? Are you binging? Are you purging? Purging is when you're purposely making yourself throw up. Those are signs that are of concern, especially with teenagers. You know, if we are parents of those teenagers, those are the big things that we got to watch out for because you know social media really pushes that to the kids these days, and you gotta look a certain way. And so, being mindful of that. Kind of talk about that, binge eating piece. Moderate fluctuations in weight gain, weight loss. Sometimes if you're seeing those changes too quickly, that's a concern. And then thought perception. So thought perception is again how we perceive what's in our mind. Are we thinking death? Are we thinking suicide, self-harm, homicide even, right? So the self-harm piece, and self-harm can be the most simple things, like just pulling your hair a lot of times, you know, scratching yourself, picking your skin. Those are all signs of self-harm. Paranoia. Paranoia is like, oh shoot, like somebody's out to get me. You know, those kind of thoughts. Delusions, where you think, oh yeah, I'm in this magical world of unicorns and everything else. It's kind of like a delusion. Hallucinations, that's a big piece. So auditory, visual, tactile. Tactile is when you feel, auditory is when you hear, visual is when you see. And so when you're seeing things and hearing things and feeling things that the everyday people aren't experiencing, you know, like shadows and noises, those sorts of things, those are hallucinations. All right. So what are some of the disorders that the Hmong community face? What do you guys think?
Or some of the major, or some that you guys see, especially young kids and growing to adulthood, or the multi-locality too. Or some of the, this is the discussion right now.
Sure.
What? Okay.
Schizophrenia.
Schizophrenia.
But I don't know what Hmong people
Oh, more had no the boss of schizophrenia, each one of them only another especially
And it's not called schizophrenia.
yep, schizophrenia get a lot of time you hear about the more what you thought more doctor doctor có yêu nó là rất là do con tư lập kia có một tư cho có một right and a lot of times especially all the whole new yeah too it builds up piece of what that big one yeah ít cho nên được sự lên chơi the more you post it along so schizophrenia is a lot of this schizoaffective disorder is it's not we can man go to look to see that the most symptom almost the same but the DSM-5 is what a lot of the criteria there is what you use to diagnose a person. But schizophrenia, no money here for disorder, lock in the bar. So, you might not have evidence test, but you go to some of the symptoms of being schizophrenia, more like what called schizoaffective disorder, right? So, it's one of the layers of your biology. It's too much you do have to start. The one whole layer nữa, but schizophrenia chúng đâu lên đó họ thì you bỏ nó share bỏ đá không chân thì nó bỏ đá bỏ hố bỏ nó right which is they know the chỉ tao họ để prove the yo hay chỉ yo right even though we can engage the just the đá thế yeah so even though in the mental health field a lot of people making knowledge of that in don't you more nó cái experience then we more guardian angel like guy I'm not this shit there but at the same time when it's too much, then you don't so only you're general, yeah, when you more perceptive of total next, or you're just total of which you're there. So mental health is where the balance, but we can't really point where is the balance, right? Where's the middle? But at the same time, it's for yourself to ask what's the middle for you. So that's the person's self-centered.
Yeah, yeah. And if you're thinking about biological, like the sciences, it's that neurotransmitter in our brain, the neurochemical called the dopamine, right? Dopamine is that feel good, that makes you feel good, right? So sometimes that is too much, and when it's too much, that DSM-5 book to help diagnose and guide those sorts of things. Yeah, and then it kind of leads into those medications that we take. We're fearful of taking those medications because it changes how we think, how we feel, and sometimes that gets very scary. Actually, most of the times. So, yeah.
this is one of what I gone through when I was at Oxford College. One of the studies that I read through it is like, nếu mà họ tribe nữa, nhớ Southeast Asia nó biết. All the Western part, the loop village, nó thế họ tribe nó mà lâu yêu nó mất schizophrenia đau hành đi nữa. But when họ tribe nữa, nó just schizophrenia nó share the tun spirit leader nó biết. In họ will create like a society where họ accept the society nữa, the way họ accept society in đó. Chỉ họ watch tông mình chỉ muốn tấn mình tao cost tụi nên là mua self harm là. So it's perception of tin nên nữa. That's why nhớ tới khi mình get over where perception, that's where society perception, no? Mental health is that's where họ lost up a line, no? Yeah. So cái dụng mất thà thì cái khó sẽ chỉ do lại because thằng nó mất study nó lo cho nên bọn mình chỉ mua education nên nhớ nữa, and ít từ mua schizophrenia là mình cần chuyên tao để mua này nó bây giờ, bởi là muốn chuyên tao thì nó ít khó spiritual lead là xứ là gì, nếu cũng cost là harm thế. Bởi vì không phải society đi tại nó nhớ tới cái mình nó cái nó cần là cái chân chơi tiếp xúc giải tiếp xúc tới năng nó là gì, nếu họ khắc được thế nếu họ nó khuyết harm rồi, because so nếu có mua sinh này nó, cái chơi giải này tan cho hai cái giải đó của cụ chỉ riêng này cụ bỏ cụ giải thế cụ bỏ từ năng lực hiện của ta lấy nó, là hai của ta lấy nó, thì cụ yêu tụ chỉ nó cụ yêu tụ chỉ stable đó, nếu như là so it's so hard to really talk to them. More at the same time, each person is different. Than just something, and one is differently, tend to present differently. Was it China? Yeah, what's the same guy? No, who present differently. Not that. So each person is unique in their own way. You have to learn how to take the step of they call it the normal ground, right? Or the for him the normal ground, not for me. But if your partner, I have to see where his normal ground is at. Let's start from there. So the thing more hard than people person center.
So I'm curious, how do you guys? So when you guys are at work, and you guys both you can diagnose people, right?
Sure.
Right. So then how do you navigate the battle between my religion and the diagnoses and my job?
That is a really, really hard question. I actually came through that once, not once, multiple times on my job here. Họ nhớ tới tiền á, tôi có yêu diagnosis tôi nâng á, nếu chỉ do để tôi nâng đấy có một thả cho khi có tai có diagnosis nữa. That's a bad way of how you diagnose a person. Yeah, how you really gonna diagnose tôi nâng nữa, có nó tôi nâng là thả ta, để cho collateral là những chuyện nâng, right? Thả tao chỉ nên cho nên gen nó nữ ta, ok, để cho medical history. Có một chỗ nó tan thao lòng, có một chú lọ, có thể là diagnose, thế thì more, thế giờ bóng đó họ hay đến nữa nó ba tổ tụi nên cha thế thì do cha, right? Họ giờ ít cho nên thổi chỉnh tốt chỉnh nó, so this issue happened, I think was back in when I forgot what year, but when all the professionals just started handing out kits, like diagnoses where. ADHD or all this, label, and create that wave, then the cost issue. 10 years later, it costs so much issue that come up, raise up, and up here. So a lot of time right now, they try to fight back on that. To how do you fight Let's try to more push it. Okay, you need more than just the information from the individual. You need collateral. Take a need your medical record. Take a need what. Cho nên không được chấp nhận nó, họ tìm được nó, có một bảo hộ, một chuyện put it together, mà không mọi người lúc họ đời nó xin lấy do đi trả tiền, họ có chỉ đi job này, họ được có gì. Someday I'm normal, someday I'm not, and when you meet me, I'm not. I could be whatever all the DSM-5 say I am, and I'll meet it, all the criteria. So they did your history, they could have known it. They should don't know, like your loved one, close one, họ do cho nó traditional, nó chỉ don't know it's hard. It's super hard as a person who gone through it. As why I say it's hard as this. Tí năng nó mà có background nó trong nó ít tu năng còn do nữ really more schizophrenia, and nữ lúc lưu yên 你叫 electron 你已經放射其中你已經 water the process 都幾殺其中你已經 really control 到很多還有對另外的冇可能會曳都冇可能會曳人冇學 base ground 啊學到係 schizophrenia 嘅嘛你全部 base ground 啊 so when you ask about a base ground it's hard for me to explain it but you have to be in the field for so long to really know how to measure the base ground第一種呢係 schizophrenia bipolar 啦你要講 right so it's hard for me to explain to you guys what it is but for me it will take me about 20-30 minutes sitting with the individual talking to the individual and for me to give a sense okay where this is leading me or where this individual is leading me and that's what I use for my to diagnose a person instead of using it okay whatever no so it's really hard.
Yeah, and it changes. I mean, you could say that there's schizophrenia right there then, but then it may change it to depression later because you find out more information later that, hey, it's gonna meet this diagnosis more so. You asked about how we consider religion and all that in it. I mean, it's a conversation. It's a conversation. You can have that long talk and talk to the patient about what's important. If they think it's religion, then you have to dive deeper into that information.
I don't think it's suicide's not a disorder, but then these disorders can lead to suicide, right?
Yes.
Bây giờ coi cụ xã sang cứ cụ tự bỏ ở bây tự tin người chính trị của người suicide nó nhỏ. It come by down to a big, everybody here probably knows somebody close or somewhat close that, did, suicide. How can we address or identify? Maybe this question is too big for this slide, but how can we, help catch that before it happens with these disorders?
Okay. Sorry, I'm gonna jump on that first. So, it happened to me personally. This is my personal story. I have burned out as a social worker. I decided never going back to social work. That happened about 5 years ago. And I decided more than 5 years ago. And then 5 years ago, it happened to one of my but where I helped raise the to biết thì nhóm lúc nên sọ nhẹ thì đã lo thế để cho tăng cho cái việc tôi đâu need to show need to cho lo là việc là chỗ hỗ trợ you get to look at me and I have a little I call him brother but yeah he committed suicide in Oklahoma he took over 100 sleeping medication pills right and before that a week before that I saw him he came up here and all I said to him was like hey you don't know I was too busy running my things or doing a lot of stuff too, so that's the only word I had with him. And then that happened, right? It become a guilt, it become a shame. So yes, there was gay suicide, like y'all attempt suicide, or y'all know suicidal, or commit suicide. You have to talk sensitive thing. Or then you have gay, you get some more help, right? You have to get some more gay, more share you have gay you darling, the king of so what if I gone through this? What if I take that 20 minutes just to stop it? I will, and especially I work in the mental health field. I could have caught it, right? Even if I work, and then that guilt become more, and then become a shame, and then that guilt built upon it, and then that's where mental health can kind of start, where you're still blaming, right? So that happened a lot, especially in the Hmong community right now. Suicide or not, it's really sensitive. So, you asked me to do this because it's related to mental health or suicide, yeah.
What? Yes, it is pretty present in the Hmong community. What are some of the underlying mental disorder that leads to mental health. Now,
So
I answer that question right now. I could say that in the Hmong community, what I've seen in my work too is depression is very present. Anxiety, the social stigma, the social what's the word? And there's a certain level of responsibility, and that I've seen that a lot too, and that leads into anxiety, that leads into insomnia, that leads into depression, and then the depressions leads to suicidal. That's how I see it. But I would like to begin to speak more to what are some underlying.
I would like to elaborate on that.
Yeah.
For me, how I see it is trauma is a, so for example, if you talk about drugs, right? Lo Yang the gateway to drugs, right? Using drugs, right? For me, I'd like to say in the mental health field, it's trauma. Trauma is the gateway to mental health. Why? Trauma, there was so many different types of trauma. Why would you go through so hard? Because secondary trauma, cultural trauma, generational trauma, right? War trauma, right? So even though basically but there's a trauma that they've gone through, generational trauma, that it actually sink into us. And that's what it really creates where trauma you lead to manage, you control way to cope and then it jump into the next stage of larger anxiety, depression, get bipolars, get build more into schizophrenia, right? Schizophrenia, didn't you thought that some people argue that it's genetic, some people argue it's not, but bipolar is genetic too.
Well, I want you to finish first.
Yeah, so how to trauma. Because trauma has so many label of trauma over here that you lost now, to not care the bay lost. But what name lost here, you want you need especially bay of your bay do you do right? You know, bay more bay just at the same time, they care trauma, no child. And then bay or bay lot to bake on there's a trauma that you carry too. When you're the only Asian, or when you're the first one in higher education, when you don't know who to turn to or ask. That's a trauma, that's a secondary trauma, right? Even though it don't impact you directly, it becomes an impact for you that you gone through that moment, and it's in your head, that where how that impact was concept that it really switched the way how you think or process at the time. So you want to know your process now. So that's just what trauma creates. Trauma happens when you don't have anyone to help you process it, or you can't process through what you're going through. That's what leads into bigger and major mental health issues.
Which is that shit with Tanzina. That she go more because just order no. Go she sa pay high that she go feel yeah go digital be vulnerable. And be on top of the king, but I don't.
It's a shared moment. So open up safe space where.
So go to bend through Hanatan, go negotiate. Okay, go I'll pack a donor. Go one dog in your share. So go Munchi, and go feel which is something that she could be. This is something that very effective. Okay, so I'll pack a donor. You could be Munchi out of being more in your share because you know my own relationships and there's a lot of trauma. Yani hai. When you could see the door, that you make a you could see me enjoy. You could see you doing more a lot of things. Do you enjoy getting more a lot of new shield, new munchi, shaking, and the Yagunia, more. And what see you Shannon Day, you know, you know, it's a shield, you know, more. How could see Chimokatina, you could see me enjoy the game, you could see 有这种的读sách tôi chỉ dùng cái gì pin ở đây hơn nó cho nó cái gì là thế chỉ một cái tí cái bắt đầu tôi nói cái tôi cái tôi in the future là mà tôi bảo you so God nên thì cứ every day they're never home always bắt đầu tôi nói họ cái cũng một cái from generation trauma nên là cái đó để cho thấy là Việt Nam mình tôi nhớ để cho mình cái nó cái của tôi thấy nó đó so I'm the second child của tôi thấy nó chỉ cũng có a lot of kinyo share because của yêu họ để cho mình cái nó của niệm một cái nợ bla chỉ always tôi cho chị yêu của nó chỉ để cho họ boli để cho họ em lên thôi yêu của tôi họ chỉ chỉ mà muốn có đồ mình cả mà cho bị một con nằm một mình chị cô feel yeah cô growing up chị cô họ self identity không nên cho nó được cô nào cô chỉ bảo chị cô ra là cô đi cô nhiều là ra là cô feel yeah like I'm Hmong American cô yêu anh mình cả là cô yêu anh Hmong and that she I was always struggling đó cô tụi king idea cô yêu liên tư đó you know because cô tụi thay lo chị cô tôi bao giờ Hmong cô tôi bao giờ mình cả cô tôi thay được tôi lấy cho mail cho tôi lấy cả tôi lấy cả rồi cô tôi cỡ off hơn đó so cho cô chị cô struggle idea cô yêu liên tư cô Hmong ra là cô đi cô nhiều là ra là cô đi cô ra đó là cô nhiều là các bạn tôi sẽ cần về thế thì mình nên nhớ thì mình cái về chịu tôi sẽ go to school cái mình cái một sinh nó mình cả một từ nó mình cả because cô nhiều chỉ có ở the company chỉ có thì or là so need still you know cái mọi chuyện chúng mình thì giống như cô chỉ or she cô nhiều she chỉ có ở lên BBC chỉ mình đó rồi she post cái cũng mà làm cái nhớ sẽ cái sự tôi thấy là cái bộ cái sự cái thôi những cái là chỉ là cũng bảo ta cái sự tôi thấy là cái cũng bây giờ cho hết cái cũng có cái nhớ sẽ cái my own relationships cũng khi cái cũng sau khi cũng bữa hôm một operation cho lúc tháng cái cũng muốn nhớ kia mental health facility kia là để những người sẽ lưu là tụi mình cho là cũng kia là sai thì cũng mới ADHD để chúng ta nói chuyện it's just that cũng mới cái nhớ sẽ cũng focus chỉ lại cái là sai thì maybe ADHD đó là cái việc đã muốn gì chỉ là thì bipolar 2 thì cũng mới có bipolar 2 là cái từ cũng mới có sometimes cũng mới energy đó là mới hơi thì mania cái cũng mới energy cái cũng hay cái nó hay năm đó cũng mới excitement cũng very my self esteem is really high I want to do many things đó là cô là cái sometimes cô ít khó tại bị khó chỉ我只当 you know so when the tia she didn't know tia you know I overspend a lot I overpack I procrastinate too but at the same time and then cô đi số mong kind of you know she did I get distracted and then cô đi số mong kia chỉ trong cái nhưng mà cô bự ở bên đó số mong là cô tưởng một energy cho chỉ là cô chỉ cho bự trong tia cô chỉ cho nó mong thôi sau này nó ít lúc mong dữ là sau này nó tao tia nhưng là thế là cái going kind of how more bipolar 2 the going not sure where like they got to stable na got to come energy and tao cái nó control got to calm down me otherwise they going no a bit different sure before the thing got to hold cái sự cái cô deny cô cái which is not sure cô chỉ tự nhiên xử lý tự nhiên mò chỉ ai cô chỉ cả nó thế thì cô chỉ nói chỉ có một episode là cô im mất lại mania work cô mà energy thì chỉ mà kinh doanh work cô mà depression kia thì cô bữa hôm sau cô ino chỉ cả sợ chỉ sao chỉ you know you want to know that okay but it changes sometimes when into the go my energy how into the go chỉ mà into the go depressed cô chỉ sao chỉ sao nhỏ so cô mà cái gì đó mà nó sẽ có in mà cô suicidal before sau khi kita sih mas sama solat ki, ku pergi aku ni nak mungkin masih ada kosong. Ku dah mas sama solat ku dia, ku tahu anda tahu mana masih ada. Ku dah kanan ku tu king, ku dah kanan. Because at the end of the day, you know, ku chỉ happy ku tu king, aku nak ya, aku tu ya yoga, ku tu, aku yo si dah kalau, aku nak jadi ku kena feel ya like ku ni jika cita tu nak jadi ku mah, tahu ya ki masih. Thì ku tu cakap jadi ku tu jika share aku nak, you know, so. I feel like I have made lots of mistakes, but these are all lessons and that I learned from King. It's all within and so that's my story. Feel yeah, we should get a actually good to the so many story when you got no first no for Chichon, what she was in February. Establish with care through the county, you know, get go to psychiatrist, go to Dr. Mochua, go to psychologist, go to Dr. Lo-Pha Society. therapist Dr. Nyoshia cũng biết có thể kiến Nyoshia đâu tu Dr. Nyoshia cái sometimes people chỉ nhớ tới đó là chỉ cũng mua gì cũng mua được mong mình cả cũng mua được mong mình cả cái thầu số thời điểm mình cả biết cái lời cái after a while you might used to be like that you know what cũng biết ta cái you should clean you hide it and that you should clean chỉ cái thứ ba là you chụp biết thì cái Nyoshia là actually at the beginning sometimes you need to đã tin lo thế rồi bây giờ you take it rồi you feel like you need to being cashier be understand oh cũng muốn thì cái gì nó you know in quỹ mới khó nó because go to sister cái go to nhà cái nhà cái social worker cái người ở thế lúc nào kiếm thì ba má hay có nói cái là thì oh cô yêu mày đó cái mày đó ba má chỉ you know cái cashier thì mà chỉ cái lời giải thích con đi go to nhà mà yeah it's really ironic because go to big Fresno, California. Go to Holito County of Fresno Department of Behavioral Health and we do mental health billing. So I'm a medical biller, medical billing coding. Yeah, we do see that. I don't know. We do feel that, but I can't continue, and I love it. You know, I love mental health billing, and then we have lots of mental health day. Like you know, the two you want, you know, or you need a day to rest. And I love my job, love mental health. So it's really ironic to that, you know, to mental health issue or mental health disorder. Actually, going all the mental health, yeah, okay. You know, usually that's in okay. Yeah, okay.
Concept, perception, and process, right? And be willing to accept. These four are type of monkey. Nhiều bây giờ mà dùng chọn đường màn đúng không? Ít lò là chỉ sẽ lấy lò ra mông mà các con kiểu cái lò mà sẽ lấy lò đấy.
Cô xin được cảm ơn anh chị thế. Thì cô tu muốn chi ở bên trong này cô nhà là cho cô mua, cái lời sao cô. Thì cô yêu muốn chi cô thấy vậy nè. Thì lấy hai thì cũng mua con này, cô yêu mỗi thứ enjoy thứ. Rồi lý là thì kind of like devil. Thì yêu mua khỏi, hay thì you all khỏi, nó là you khỏi like the good and the bad. Like you know what's right and what's wrong. But sometimes like go to kitchen, which go to kitchen, like which go with kuha intuition, like you go say okay, which hana they yo. That's which you wanna get more stuff that happen to go where you just kind of like you know I don't see no you the king idea, which you all call you yo la call the thing like cái lấy cuối cùng sẽ ở bên tôi cái lấy cái cũng mua honey cái cô you continue that journey but we important that we believe with the king that we mua mà we important because I would wake up every 2 hours at night, like 2, 3, 4 in the morning, and things happen. I mean, when you show me, something happened. That she, that she going like both more something, but it's just that I haven't continued on that journey. That she going both like take mom sticky too, so food or to master. That she would do both doing that she was still into the talk and that. In moment you that yeah, okay, good to look at your queen, you're like morning that yeah, okay. In the head that she wished to, you know, do my journey. And that's the more with the one color that she could just stop behind them. Là bé không em mình là to do late to how many don't work aside they show you more cunning or you internet.
Yeah. So people feel comfortable to share it. They did stuff like I'm not giving a safe place to share life. Or they think you got share that you share it, that you feel comfortable share it. Really, trong mình kể là những tuần thọ lên nó gây cho họ từ lần học tại sao có cho chỉ tuần thọ cái cho họ từ giờ họ thấy họ muốn là người ta nó lo nó thì người ta phải người ta có chuyện bây giờ người taอยู่แข่งไปcái thọ có suicide đấy suicide attempt rồi suicide rồi or commit suicide thế là cái với Hmong community right now tất cả cho lo tất cả cho lo giống như giờ tất cả mọi người tôi áp một số khoản của nó giờ họ giờ như thế nông của thế đó chúng ta chỉ chơi ở khuê họ và thả ra tập được đó bây giờ nó lùa thế chỗ lò nó bị bỏ chuyện mua nó bỏ tay của họ chỉ là kịp bán đi cả rồi thế mọi người làm sao
tôi phụ hoàn chỉ nên một cái mà cũng chỉ là để plug cái cổng hòm nó bây giờ cho họ thấy không nè mà giờ có thấy tôi sẽ thấy nó cho chỉ để xong nó cái ý họ thấy họ mua rồi nè cái thấy họ lần đầu cái không khí cái cổng hòm nó nè mà tí là rồi bây giờ mà họ lựa mà được không mà ý họ có chuẩn bị rồi thì để đi bóng bây giờ rồi có họ nên số cái là có số sai tụi nên con gì tụi nên cái con luôn là nữ có số 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 phận nó còn không chậm nữa nên mà nên nô kia hay là nên muốn nó mà giờ nô kia đó là nợ cú phá mà là mà phá kho còn này nè để bán hàng người này cái gì vậy mua họ chuyển nô thì ok giờ tụi này người đóแต่สมัยก่อนเรายังบอกว่าตัวเองมันทอเส้นเส้นนอนโตเท่าเราขอแต่สมัยก่อนมาเชียร์เป็นห้องเกษตรสมัยก่อนเนี่ยแล้วนู่นแต่ก็อีตัวนั้นก็บอกเจอตัวพวกนี้เดี๋ยวไปอย่างที่นั่นมาเจอให้เช่าโดนเจอพวกนี้แล้วเราเดี๋ยวถอดอีมาเจอเราไม่กล้าให้ตัวเบบี้บูมนะเราอีตัวที่นั่นซื้อเรามั่วเกณฑ์มามั่วเกณฑ์โจตัวพวกนี้โจเกณฑ์เนี่ยเอ๋มั่วเงินมั่วเส้นถอเส้นแล้วจีเราลงเส้นเราก็หอมตัวนั้นไงก็หอมลงฐานเราเท่านั้นmà đó là chia để biết của plug hay là cái số lượng họ mà muốn có một cái cộng hưởng đó cho có cái cộng hưởng đó có cái không phải gì có một cái gì thế rồi có mua cái bán này nào thế nào rồi chia để có họ trong share đó là真正的那个你把车搞掉
You're right, Secretary. So, it's a sense of purpose, right? It's a sense of value. Yeah. Where có create họ where có cho họ đó đi từ công họ tinนึงมัน differently นะครัดีจะมาเติร์กงหอยดีไม่ได้เป็นสิ่งอะไรจะเราแล้วเติร์เก็บล็อกเก็บตัววันแล้วพวกเก็บพวกยืนแล้วหรือหอโชว์surrounding นะ either you create a lot of things benefit to yourself or the mental health too because a lot of times you self value เราดูปอดดู value ในหอ community นะเรายังเราหอเกิดตรงนะไปหอยแม่นะ or เราจะอันเจนแค่เงินเดียวโอเคYeah, the one we don't do that, low general, no, we didn't part of something. So, I think we have to be a part of something. But you think, you have to make you a part of something again. Mental leak, depression leak, anxiety create. But you start that you started out, but you judge really get out, right? It's a be like anxiety create, anxiety get. Anxiety, no matter you get to something, it's okay, you try that you stand out 去日當呢，你要隨時日都要咯，而且我 anxiety 嘅，同個 stand out 去日當呢要乜嘢隨時都要咯，注重都要啦。如果我哋 stand out 錯咗嘅，你睇我都要 share 啦，要 share 好，要 share 嘅，你幫到我完全乜俾啦。
Speak to how do you not go overboard with the with your commitment to the community versus your own family, you know, and we often see that a lot too. Earlier we had those discussion of the drinking, right? The commitment to all of this, and then eventually your health do fall apart because of so much commitment as your parents, or as you speak to your parents, because you have to put in a lot of that effort. Speak a little bit to how and what are some things that we have to be mindful of when we're going overboard, because that is also a double-edged sword of leading to depression, anxiety too. So,
so the biggest thing to that is, like I said at the very beginning, we have to reflect and we have to know what our limitations are as people, right? So and we need to be able to prioritize ourselves first, you know. So we need to put ourselves first, because when we cannot put ourselves first, then that's when everything goes haywire. Mental health, and so a lot of it is reflecting on that, and then knowing those signs of when anxiety is ramping up, right? Those are those very first signs of, oh, you know, I feel very tense, feel very stressed. That's when you need to start taking care of yourself. You need to understand, okay, I need to just take a break, I need to take a breather, you know, I need to understand that, you know, I come first. You know, because if you don't do that, then, you know, maybe into those worst case scenarios where you say, okay, well, I just gotta take that action, and I might hurt myself, hurt other people, you know, and so being very mindful of how you feel and just reflecting on a day-to-day basis and say, okay, well, how do I feel tonight? Maybe when you go to bed today, ask yourself, how did I feel today? When you wake up in the morning, ask yourself, how did it? Try to be mindful of keeping something to move forward to as well, right? Because a lot of the times, people who suicide, people who end their lives, and things like that is because they don't have anything to look forward to. They don't have anything to keep them connected to the community, to where they live, to Earth.
Và nếu anh chỉ buat dia, dia trong mình mà thay mấy đó họ biết đó, dia một ta tôi họ biết mà dia thầu có họ mua cái mà chơi nào vậy, một cái số mà số sai hết mà vậy,แต่สิ่งใหม่ได้ประมาณคือmột cái nhiều shit rồi thì để chủ mà mong đó vậy, so mà ba biết đâu sẽ là hay dia lúc xí hồi từ lúc xí hồi do ai yêu họ muốn chỉ tụi này tụi cứ mà họ mua ba yêu mà tụi mua họ báo họ nó sẽ cái mà nó shit.
I will break that down first and come up the almost circle đó họ what you have okay. So chỉ có một vấn đề đầu tiên thuộc họ perfect line cái do khu để nâng vượt báo là do cái do họ buổi cái do họ từ có khu báo right. Thôi có thứ lại có tụ kinh là do thôi nó có thứ nó one trả ăn cho lỡ rồi có thứ attempt là nó khu cho ý là rồi tụi tôi chính chấp là right. Thôi có xã cho xí nữa thôi có một học sinh xã to cái xí nữa crisis line nữa là bảo một cái resource là chân nó có thả kì còn nữa có tiếng nên thôi có xã choเขาอยู่สองcái sau nữa thôi có xã họ chỉnh nữa họ mua chỉnh nữa that only happens in 5 to 10 minutes but nếu từ chân nó có thả nó bỏ nó then you're back to normal but with high intensity nữa chỉ là thì còn là thì là chúng tôi tự thả nó that seems to nên nữa người ta ages nữa người ta like lúc chạy nhung là mà người chịu mù đi ở người stop tôi cũng nên nữa bởi vì hôm qua ít tôi nông đi cũng mua na cũng tôi nó chỉ chắc thả cái li 5 to 10 minutes nữa I could go over that everyone not just at the do nó mình giờ mình luật sự qua sau cái lúc nâng anh bên xã cho ý cho cái lúc nâng bên xã cho họ biết rõ cái kinh họ nói họ true nữa because there's a lot of time when I do to nâng gì you mistake them people are there the more of the mistake but what more of the lesson right mistake you got you caught like you become mistake so actually có cỡ rất có bốc so like become a lesson so it's a lesson learned lesson life right so có perception họ có learn something để quay lại sau đó for example họ cũng chạy school để chỉ chọn hơn mà right em cũng trông tay cũng còn tôi sẽ sharp right liên quan tới that they all $10,000 mistake right but that's a lesson I learned how có chuyện thì có tụ kinh có một họ event là sáng tới có món đồ khởi đầu có tụ kinh thì người dân đi chợ nó bảo tê nó chỉ họ đối với họ giỏi phát có chuyện phát có nó if you see that as a mistake shit cũng có phá đấy cũng chỗ là cũng ô tô kinh là ô tô nó có phá đồ là đấy you know nhìn thấy bông đồ rồi cũng yêu nó cũng bông đồ là become a kỳ sáng nữa right cái down the road cái chỉ nữa sâu nữa cái nhiều chuyện nữa cô cho cô lesson learned cô lo ta lo nó cũng lo one everyone clown me about it and we talk about it laugh about it ni là cho ra là wow ya cái support là nhắn tàu có sao you laugh about it and become a joke at the same time accept that and then you see how much you don't want to ever go to you know so how có perception có bỏ được you có bỏ được how much I value and how much you chỉ được lúc của mình có khởi đầu sau này thì nó không lesson nhưng mà it become a lesson you need to mark off down long run but when you cut then you have a mistake no that weight heavier as time go by and that's create or into where thọ có bỏ cái kinh chúng mình thọ có mỏ là nó để có muốn chịu tàu nó thì có sợ thì có sợ có sẽ đấu tra điều chỉnh mọi điều lại rồi hơi đấu tra thì có cho cái sáng biết tự rút qua nó thì thọ biết tự rút to là được thì thọ có thứ lại có được kinh lỡ rồi có thứ mà hai lần dùng gọi thế it's a sad way of saying if you attempt suicide and you did not accomplish it, you attempted already, call 911. They need to be there right away to respond first, check what's going on first. But if you think about it, you have a thought, a plan, but you haven't carried out, call crisis. There is someone there know how to talk to you, and they will send someone come out to your location and assess you right away. That's why it's a responder, right? And now a lot of sheriff departments and dispatch or a lot of police right now, they have embedded social worker, where they're trained to, like me, trained to be in dispatch to answer mental health calls coming in, or learn how to pass and then what you share to some who do not take it back or your literally do someone to validate this, you know. Some people, that's all they need. What you share to tell now, literally to validate this, or need to or you know, hãy lo được rồi luôn sự gì, rất tàn thọ, rất nhiều chuyện luôn rất tàn thọ. So, ôn định mình nhiệt tới nhiều và là cho bên mong là họ liên quan tới những chuyện hay là những họ ý họ chủ động họ để bên mong bên lo tôi which is a great trait của chúng tôi thì họ trong đó là nhau lúc xảy ra những chủ động đó because bên mà bên nhiệt bên gì bên phong bên những cái hay là bên bên ôn trong luôn, right? Sai luôn đấy, bây giờ bên mong nữa thủ thế cho tên luôn là những mối tương mong tôi có trong này khỏi tương mong tôi kể ra we start by the lời tôi lòng đó we start the since có một niềm bao right you more you community tight at all huh it half the time you forgot to thought about yourself self value right có một everyone đâu có chuyện nâng có một có ít đôi tí có một có chứ chỉ là nó có chuyện nữa có lúc chuyện nữa có quan điểm nhiều xưa có một bình nhiều hết có quan điểm trong đây có đấy hiện thực cái hiện thực này có chỉ lúc có thực hiện là có lúc được cha có lúc có thực hiện hiện thực này thực có nào đó so một bị cái một lần rồi thì vấn đề có những chất lúc lần tư nữa có chụp lúc có thực hiện đấy cho giờ họ lúc có thực hiện họ thì YouTube bốn lúc thực hiện đấy có phải để thầu cũng đi bao giờ thầu thì you know the right? Self-reflect. You got you self-reflect, or got you both at the way of doing it, you're true to where I'm at now. Who do that from your hot to hot right now, you know, right? Got to look at the subject, no, got the whole reflect to self that. Oh, you have to got your assets, so got to king, got such a loud to Suna. You can use stone, look at the king, they're going to work out to self, take care of yourself now. That's where mental health great. Higher. Only like the snowball effect. Actually, mental health is not a snowball effect. It actually is an avalanche, right? Yeah. So.
Yeah, you have to think. Okay, well, am I isolating? Am I keeping myself away from people? Am I doing it more? Am I going to work? Am I going to school? If you're not doing those things anymore, and you're like, oh, I'm just so tired. I don't want to go to school. I don't want to go to work. And those are big concerns. Those are issues that we need to start addressing with people and say, hey, you know, maybe something's off here.
Speak to barriers within the community or within a personal too. What are some barriers that prevent people, personal or societal? What are some common reasons why people are not seeking mental health treatments? And then speak to and give some strategy on how to overcome those barriers.
I think a big one is what we mentioned, the sense of feeling shame, right? And so we are very family oriented. We really want to appease our parents. We want our parents and our family to feel satisfied about what we do. And so when we can't do that, we can't fulfill it, they shame, and we feel shameful of what we have done, and so that's a big barrier in itself to just go and talk to somebody. And a lot of that has to do with, okay, well, you can't really change your parents, you can't really change how they perceive things, and so you need to then reach out to somebody that you think will be willing to listen, whether that be in the professional world or whether that be with a personal world, with another family member who you might feel maybe more understanding of those concerns and may be able to find help for you because when we have those mental health issues, I mean, our brain is like so burdened, so full of other thoughts that we don't see straight anymore. We're kind of going all over the place, right? And so that's the biggest piece, is just reaching out to the person closest to you that you think might understand. But yeah, I'd say one of those biggest barriers that I've seen is the thought of shame in itself and the thought of understanding.
I think, sorry, they could về cô mình chỉ mình rồi nhà sao gì nữa giờ for côจะ copy this thing how she done cô sai thì like cô ơi cái cô phải là rồi tôi judge you that she at the end of the day you judge you to keep not chop up because you say that you say that so you that she you do say that so like the do like the people that like because you think other people are judgmental about you but it's just my own mind cô lúc cái sai thì cô very critical of the do that she at the end of the day cô critical of the king chop up cô judge the king not chop up cái cũng muốn hỏi she like oh you know like for example like cô watch it cô đi vào it's a bit so or that she do or that với cái gì feel like cái cũng chỉ đã chỉ được the king kia you know chỉ trong chỉ được the king chỉ happy được the king kia và ta nhà gì thì thôi nó cái chỉ qua ta được cái chỉ đã sao cái the oh we were gay and the more a lot of shame and guilt that it was the more Kinoshia and then I was gonna say something else and then about about what about not calling 911 how to buy the thing the good king I just needed someone to listen to me. I just needed someone to just go like go clear itu nih nanti go feel ya go sa so the king no go sa actually nanti to itu mau nanti tu kata that also mesti kita bisa itu the first time they go in your friend hai so your friend itu beli ke sekolah dia go no go sorry no you know ma we're doing nursing and like that we're just doing big hot jobs and big holiday being more mental health training no cái sao tôi share là không beli tôi hay cô hay tao tôi kêu cái là tôi qua là rõ rồi là tôi không beli cho beli tôi và also the first thing của tôi cũng hơi cái second time của tôi cô chỉ hơi because của mình một cái nhiều share cái này của nhau store là của tôi là mình chỉ lúc của là chỉ là something or của feel nó tôi là like it's just not one thing it's a lot of things nó tôi là okay nè. That she one thing triggered everything okay I have a lunch. That she don't do the day long and don't log in. In the key rồi cô attempt. Thế cô hành sao thì là tôi try cái thế cô the last time okay was actually last year of it's October 2024. Okay, that was the last time but cô call 988 thì cô đâu tôi kinh moment because now cô do more to 2018 2016 law. Okay, that's not, I'm very self-aware about it. Okay, who feel like we want to be this time, who Dr. King, who okay, we need help right now because who feel like we all want to have Jesus, like you don't do that because you kind of follow it, you want to thought, it's like you doing Jesus, you don't do that. I think she sometimes Jesus or something that she, nó từ hơi tập tàu hàng rồi nè, cái cô tụi nó bị cái ba cô tập tàu gì cô nhỉ là to equal part of the teaching before too, you know, that she we stay for us kids. They could go fair when you do stay for good day. When you do look good, stay for good day, because which is our book, when you look more for Kuna. Look big on going to share, when you see when you're shaking, we felt that it's all one day, but do you share with the circle that day? Go on the hour of when you would see no shares again. We have Kuna the shaking, could see at him, who felt, who told him the day. Go on going to share again. Có thể là tin là lúc tôi kia thì ok, rồi là tôi cũng tôi thấy rồi về cái kinh sai rồi chị chơi hay rồi rồi mà có một nhà một gì có một phương như có một you know từ lúc có một everything người ta có sao cho cái như đó cái gì is which both tiền là you know you don't do nó you thôi như thế cái trong đó là cái chúng mình thì bao nhiêu both tiền thì tới mình một gì một phương như là mà nó là chỉ bao một cái đó là you told me to give hints to it because I became very distant, which you know, just like what you. There was that like I'm not which you move, was I know, which is chọn the dog, which is chọn another top, was I know good things. Cái cũng mình chỉ bảo là cũng mình chỉ phải là oh cũng yêu anh nó cái nên đó là cái that's all I can explain. Mình nhìn thôi rồi, that's all.
Thank you.
Thì mọi người này
Thank you, and thank you for doing this. So I'm just more curious too, I don't know if this is all the presentation, but wanting to know more about what you guys have advertised with discussing mental health and its connection to shamanism.
Oh, we still have more. This is only a discussion.
Oh, okay,
I'm still
'cause
gonna go
I know
on.
we're kind of...
Yeah.
Yeah, time.
Yeah, sorry. I'll take the next week, and
Okay.
hopefully
Yeah, and then my other thing I want to add too is great, thank you for sharing the signs and symptoms. But I would say before, and I say this because I'm a mental health case manager myself, so I'm kind of familiar. Before all of that, I know you talked about looking at the signs and symptoms, but like if it persists for more than 2 weeks or so, that's where you should like initiate the help with therapist to really highlight that versus waiting until you or you start to share me out. So those are. So thank you to the sister for sharing your story too. I think that really resonated with. That's like a case scenario to all that we're speaking of. So like when you share of a safety plan, right? That's your safety plan of talking to your ex-husband and your friends, so they see those signs. So I think it's important to have a safety plan, right? Before some kind of thing, but it's also so I just wanted to share that too, and I'm just curious to what you have.
Thank you for actually sharing that. Yes, on the where and I'm going to bring back one. You're right that.
比較睇呢㗎，佢幫你補上你冇㗎，後邊你看睇嘅，要俾我可能你入邊你冇法，你不買，我講啦。
俾我 I'll pick a question. Yeah, I'll pick a question. So now I keep it my move on, Tom.
So speaking once again like present disorders in the Hmong community and like access, right? Because you guys kind of stated yourself earlier on in the presentation that we don't have the words, right, in the Hmong language, and seeing that from the perspective of like, if somebody who doesn't have a lot of strong English language understanding is trying to seek help, right, from a professional, and they don't know how to express what they're dealing with or what kind of issues or symptoms are occurring in their life, how, as a Hmong professional, how do you kind of assess and then look for the correct disorder, the correct diagnoses, and the correct treatment for a person if they don't have the words and the language to be able to express, like, this is what's going on, this is what I'm dealing with, and this is what I want to see?
Yeah, so as far as targeting that, it's more of just asking about starting with those physical symptoms first, right? And then figuring out from there, okay, how is that linked to the mental health piece? And so if they already, for example, they've already seen the primary care doctor, and the primary care doctor says, oh, there's nothing wrong with you physically, then you can start saying, okay, well, there's definitely no physical diagnosis. They did all their lab work, they did all this imaging and diagnostic, then you're definitely sure that, okay, there's definitely something physical, and then you talk to that person, okay, well, again, when we mentioned about the anxiety piece, and you're experiencing any of those physical symptoms, tired, do you feel like you're, I know mood, Hmong people kind of define that differently, right? And so a lot of it is kind of just slowly understanding themselves, and it takes time to kind of figure it out for sure, exactly what the diagnosis is. And so, just keeping it simple and basic at the very get-go and understanding, those physical symptoms first, and then trying to link it then to that mental health piece.
So, I add on to that too. Working in a crisis, especially crisis, any situation happens, right? And you have to deal with it, you don't respond right away. Yes, it's harder. Like it's harder to really to diagnose that because your law because you need to know the time. They don't know. In China, what are you get out of the don't know the time because the certain points out to really know the time. Because a lot of translation got lost in that. To be honest, the either of the no, you share. Oh, this life is so hard. That's it. But on the other hand, the way how bây giờ thông á, nên才到那个责任比较鲁蒙啦，right？ But me get here, I'm trying to get this started, so it's hard. You don't know what you're doing. There, you are not. You see how there, you have to take your time, right? Your law, or your glory pain. Yeah, there's a lot of stigma right there. The pain was all not bear, where I'm social bear, everything, but at the same time, you know where easy job because they should me get here. At the same time, you took being keep out there. Yeah, when you especially in this field, then they like got rest on don't use what instead of like my first year when I practice mental health, I suck at it. You should try there. Look you try or learn try them, right? Because you both response, but as you come out all of them, then they nothing you both have more and you have the one it's good to have safety plans. Good. Anything can happen. So just like this. So they told you more safety plan. Told you so crisis game also happen. You talk to your Nelson.
I'll add to that, to your questions, yes. So coming from somebody, so I'm a physician, I'm a family physician, so if, there's no words for diabetes or high blood pressure, but people like, and so I see a lot of mental health and depression as well, and the way that I catch on to that is knowing the community and knowing what kind of mental health are more prevalent. So for example, depressions. All of us have depression, especially cho lâu thế này ạ. So they may do to a clinic and they may come as to talk to me about diabetes, but all of a sudden so that triggers something else. And so it comes with experience and just the knowledge of knowing what mental health are more prevalent. And then the other part that I really like this, because the other part, as younger generation like us, are being open about it, right? And just open and talk about it. It's the Hmong community, we don't talk a lot about it, but also that's true to the main society as well. It's just so much stigma that is attached to mental health.
Cô sao ai là chỉ cô để mà nhà khai cái sau đấy giờ lấy rất là sau đấy nhưng mà tất cả những chuyện đó chỉ biết chỉ biết thôi, because mấy cái friend là show cái status, là show là chỉ là tu sẽ vậy chứ what's wrong, nothing. I think the thing is how you don't put in the not important, just based on my experience, and just I have a lot of friends who have suicide who do shit because I feel like I could have been that person's friend, I could have bonded. So for me, I was like, yo, come on, friend, hey, actually, just ask them, hey, reach out to them, just touch or comment, message them individually, be like, hey, gosh, I'm okay, like what's going on, but I mean, it's not that sometimes learning to check because of the subject, you would tell sizes, you like, she got okay, yeah, because a lot of people, like, but yes, you might issue, sometimes you got, but then you have no idea. Nên là khi đó là khi sometimes you just keep it to the king and mỗi ngày nó to you the king to không thứ nào cái bé mua a lot of them where they TikTok sometimes sorry cái nên là cái where you just clear lên từ cái you keep it you the king cái những cái or you lose share not share or do share or what you share because you're not sometimes you want usually you hay thay you must have cái you should think gì it helps you a little bit to talk about it to someone but you ever keep it cái thứ you bottle up cái nó cái it eats you away sometimes. I feel yeah. You feel that that's why I feel like when you go to doctor, share with the therapist, they kind of back because you don't be someone. And she feel she understand that she go better to not be someone to do. Shampoo you do feel better. Yeah, sometimes you try to do better monk, try to do monk because each other. But don't say low, you don't monk you monk and try a lot of stuff.
Last question.
Yeah, I know.
No, that's okay. Thank you.
Dòng chiếu ở nên chơi được cuối chừng đã lúc trong chiếc thả cỡ và mental health và cái cú lúc đây của chân va vui nữa cú ấy tôi phóng rồi tôi lúc còn hồ change đi chơi được cái rồi tôi bỏ linh cọc on được thếเขาตัวนั้นเด็กกูสาตัวลงเด็กกับสาเด็กวันนี้นี่ขันเนี่ยมันชอบเข้าตัวเก่งนั่นใหญ่จากเด็กคนนั้นเขากูสาเขาเอ็นนั่นกูสาเชื่อมันจีปีสื่อเรียนเดียน้องนี่ไปเช่นอย่างสีไปมั่วเก่งมั่วเชี่ยมาตรงนี้ไปหาจีขึ้นเชี่ยถาตัวที่มีหนวดที่แล้วชีงจะเชี่ยสั้นเนี่ยไปหาเก่งมั่วเชี่ยว่าไปลองเนี่ยจีnhiều những món nhiều ít là cái mình bay cái nhiều ăn thôi nhiều tôi giá lẩu mà giờ thì là những chuyện thích nhất thà tôi mình nói thì đây rồi you talk are very isolated town where you to open the you have to make combine cho tôi mình nói thì là have to bảo hay thì why is my mom and my dad like that thì là trong này là rong tàu kỹ lúc nào là yêu thiết thì là không có là ổn định passion thế lâu là thì họ communication là need to open cũng như ta thì tới giờ còn đây là chỉ biết tao với cho workshop where actually healing process where done thì và những một cái lúc xem là người tuân thủ người họ cái lúc xem là từ ngoài cái là họ lo trong mình ta bây giờ họ uống nhiều thì chỉ lúc bỏ lại trong cái thêm mùa lại thì thì lúc cái họ chỉ phải có sinh không thì they grow with their grudge thì trong này thì khởi chí mình khởi chỉ thì là chỉ có pass khỏi trong cái mình nhỏ thì trong muốn thêm muốn chỉ ta lý thứ thìแต่มีหยดแล้วก็มั่วคาเฟ่ในเดีย my mom and my dad will never understand me กูจะถามเราเลยชิมน้องกูเลยชิมแค่เชียกูในดีแล้วมั่วแต่เหมือนเราเลยมุนชีแต่ professional เลยตรงนี้ว่าแต่เขาเจริญจึงต้องเลี้ยงตัวเดียกูฝึกละvì tôi phát hiệnอยู่เชิงตะกี้รู้เนอะเขาคุณก็ไม่เขาก็ชอบจริงดีเท่าเราเนอะที่มั่วติดเช่นนี้เจแล้วก็เดีย they work so hard to try to please ตัวเราไอ้เดียว่าแต่ก็รู้ตัวซึ่งก็จีรุ่งถ่ายกูที่เราก็อยู่ที่นี้กูแต่ชิมว่าไปนอนเราจ่านั่นดีเลย try so hard to please ตัวเราตัวเนี่ยตัวตีมาตรงนี้นี่แต่เขาก็เกี่ยวในตรงนี้ doesn't matter what they do it will never be enough ที่เขาตรงนี้เราที่เราตัวเสียเราตัวแข็งที่เราดูเราทำ best เราจะมีอยู่เราตรงนี้เราจะ pass on the right feeling the right moment แต่อย่าตรงนี้นอนที่นี่จะรีบต้องโดยเขาตั้งเหมือนว่าลูกพ่อจะเต่ายิ่งยั่วเลยเราเลยเต่าเลยเราที่คุณจึงต่อเดียตอนเต้นนะคุณยิ่งสานต่อไปเรามัวจะวัดชันนะ more frequent ก็เนี่ยเราต่อไปจะกินยุ่งเชี่ยเนาะmột trong những đồng của bỏ cái này có chú để chú là thì cú xá trên trên của tức là nên thả thọ ta mà thì cú xá của cái real life nó tất nhiên nên có cái điều quan trọng là
một chỗ cái tụi cái chuyện một chỗ luôn luôn thế nào để chính do cái hải thì là làm sao thì cái ta cũng giúp biết là cái Allah rồi có thể help you to do trauma bây giờ lúc mong chỉ cho cái việc thà thì thì kỳ tổ chức tổ chức này cái nó sẽ sẵn rồi do kỳ kinh nghiệm bây giờ thì chỉ cho đi thì chúng ta có một họ bây giờ thì cần xài cái này thì bây giờ hiện gì lúc tôi sẽ chỉ muốn được tôi xài muốn được ít cho cái nó cho share tỷ đồng một tổng đấy đó chỉ được một người đi mua chỉ được một thà đâu được cái tôi hiểu cái một tôi sẽ chỉ cho share creator họ trauma tôi hiểu là secondary trauma tôi hiểu là trong một vấn đề thế nào họจะตู้เย็นแต่โอ้ยตัวตู้ยาโอ้ยเขาตู้เลยอยู่ซื้อเขาตู้เราเนี่ยจอยอยู่กับก็สิเขาเตี้ยเตี้ยเป็นพวกว่าอย่าไปจุดโป๊ะโอเคเตี้ยไปชิดชิดเราชิดถ่ายเลยเราชิดถ่ายเราเยอะรีบมีการมาแล้วพวกนั้นเราอยากรีบเราขอแต่ restore circle I was a part of that so Dr. sorry I forgot his name butแล้วเมื่อเขาบอก restore circle นั้นเจนเราเชื่อตัวฐานเราอยู่รู้ว่ามุ่งนะครับเนี่ยฐานอย่างนี้แต่ถ้าสิ่งเวลาเดี๋ยวนี้เชื่อตันทอเขาเดี๋ยวอย่างอยู่บ่อเนี่ยเขาสักกี่สักเลยสักกี่อยู่เชื่อเลยสักกี่สอบเราเขาถึงหลอดนะเอเชื่อเลยนู่นอีเรื่องนี้เขาตาเราใส่อยู่เขาอยู่กับกระตุ้นเชื่อเชื่อเยอะอยู่กับกระตุ้นเชื่อเราแพ้สักสิ่งว่าเทว่าเจเนี่ยรู้เชื่อจริงขี้ตัวนั่นอย่างที่สุดก็รู้เชื่อขี้ตัวเนี่ยเจก็ be willing to let go be willing to understand be willing toก็ขอ perception ที่ก็ขอperception นะก็ willing to accept หรอกนะที่ก็ willing to process หมดนะเกี่ยวกับเขาก็ชื่อตัวก็ตัวคิดตัวกี่ยูเชียนะand แบบเป็นพงเกี่ยวกับเราเยอะเขาวันนี้มีว่า说ว่าเชื่อมง是单头行เชื่อพิจารณา是单头มีการเลยเชื่อเลยหายในเราที่单头อย่างเดียวเขาเสร็จได้ว่า主要係มีการนั้นเราจะเลยจะมัวgần tới xe là giờ cho tới chỉ nên mà như vậy cho ít sự gần tới chỉ biết không mà biết chưa cho lùa nó thì cho gần tới thế cho lâu là chỉ cho chưa cho gần sức thế chỉ nếu mà nó to giờ nó chỉ chùa nó để thế lùa thôi nhưng lùa nó một bé đó chỉ là một cái thả một cáiตัวที่là bây giờ thả gì một đấy sự gì thả gì kia kia thì gì bỏ thì khi vô bóc phá tụi nó tổng đây đi chả lắm để bây trả cái chỗ mong là có cho chỉ rủ sức他们谈了要 ก็รู้อยู่ว่าสอนใน where home มองเที่ยวเราอย่างเรารู้ใจแต่ but for me I was a lot way different than most of the team during that time. I kept seeing stuff. I kept doing something or keep knowing some weird stuff that I couldn't really explain. And then good you can't do it. You should be normal, but then what you do, you do. When they show you call you the what you tell one thing you the what which what. The third job what draw the third end draw. You change you to try there. So which part is your right? And a lot of time you in charge of what you try to control it. The more you control it, the more you can. And then you have to learn how to accept it. And that's the hard part. Especially when you're doing on where you know how yeah, nó không được sự thế, especially nhiều món ngon mà khi mà họ sẽ chỉ là cái là thế là mà không được sang đầu là chỉ cái đến ngồi dậy nó món gì mà nó luôn hay thế, như như sơ quá chỉ tối họ hay nên bỏ trả như chúa cứ thi là giờ chỉ nên như sơ quá chỉ có tập bao tổ được, right? Which is being new but at the same time, 20 years it's so hard for me to come out to tell all my family that who's a name, they go on name, which. A lot of times when you got one in to shan đó, chủ yếu thì nên bảo hành của dân nên một tổ thọ của đi xịt thầu của tất cả sự, hay có cùng one in mà, thầu của thằng của từ bên miền á, của chúng chỉ tôi học kia thì của dân nên nữa, right? Because you so off, people see as a blessing for me, for của chúng self, chỉ là được. A lot of times it is a blessing, but it is it's a curse. What is the curse? You have to know part of what you show, right? Yeah, but you know, or you bought it, or you know, what you're here, you know. In the leader step of day, what you should not your child. Yeah. Perfect example is where when you near you will get that law, you're not wrong. For that first month, I have a sense that, I should wow. And then I was like, wait, we get that in to lost you, we can go into that law, we don't do the law, if we keep sharing. You get to do everything for the what is it? You have to say, yeah, my you should have to lock all of it. Any bit you had to pay the software, you have to say something. What is it? One does you watch it. 我们一力的过来带起腰，但是我们带还都都在的，有的我们多老了那带对个种个，但是我上不是，今天讲到你莫 expect 到后面之后，真莫 expect 到后面就讲到我要Lo-Pha Society 的去走正，我过度听见我过度弄到不是多弄个。This expectation stuff that start happening on the go. Yeah, go ahead and concentrate on that. Cái này cái giờ nhiều hàng, nhiều lọ món lọ chú lọ hài lọ cho họ mình sẽ học nó. Ta chỉ những cái họ kiểm tra một lần ba tuần yếu, vì thế dùng trên đầu tiên ba tuần yếu là gì nữa. Khuyên tôi bị học bắt đầu học perception là yếu nên, right? Yếu nên cái trả là những cái nhận gì nó sẽ có nhiều lọ trên lọ thì nửa ba tuần, right? Đi dùng, for example, đi cũng có school rồi nó trong của nó, chỉ dùng để gì cho tôi hay một hôm đi chỉ là share lo là, right? Chỉ là share lo thì cũng share lo là nó, chứ không cũng share lo là nó, chỉ kiểu mỗi khi cái tổng thể có tổng là tổng thể thì cũng chịu mua là nó, right? Chỉ nếu mua học kiểu nó create họ nó down nó fact lo, họ down nó fact là chỉ đầu yếu nó hay to dễ rồi, và không report fact. Họ report fact mà lúc tận đây không thông cho mà có bỏ thì nó chỉ họ report fact, tôi report tốt là gì major chỉ bỏ nó chỉ họ major là họ where you soft you off and you balance you off là, thì that's where normal is at, right? So that's how my ideological thinking is at. So number one time they put your branch, right? So branch mà nâng mà muốn nó cũng nhiều tận cho. Bên cái này thì họ cái mà tàu branch nữa, right? Cái kia là cái nó cũng có thằng họ làm bắt đầu yêu phần tàu yên được cho ta chỉ nó là sức ít cho chỉ để hiểu yêu personal của mình chỉ mua là nữa là do nên chỉ là cho là do chỉ mua cho nên một giờ là việc thì nên gì mong là thành phố nên gì right nên sự gen nên chia là một đầu ít cho một nên chia cho một nên show so cũng cho thành nên chia so thìแล้วมันนึกว่าใครนึกเขาทัวร์ right so แล้วมัน all this pressure of one name which is 其中一半的 OK ตัว就เราวันนั้นสุดตรงซึ่งมี different type of way วันนั้นนะมองหรือว่า a lot of different type so ไม่อยู่ generation ต่อแต่ OK อีกวันนั้นมันจะตัดถอดของเราชี้ย้อนเลย so ไม่ต้องบอกว่า OK which branch it is พอจะของนั้นขอตื่น right mostly แต่ฉันไม่ชี้กี่อย่างนั่นสุดท้ายนั่นโชว์เรายังนั่นชี้กี่ว่า a lot of right now จะนั่นบอกให้ที่นั่นกูชัวร์เลยจะเราเขารู้ในกูจะบอก all รู้สึก but that's it but mostly กูเชื่อบอกที่ยังได้เจอว่าเลยแต่ที่พอเติมอยู่บอกแต่ brief time in my life so oh sorry okay different type of kineki okay so kiểu nó gọi dây là chỉ được mua oh sorry let me go back kiểu nó gọi dây để đi one neck shy one neck sa one neck call right one neck call nó bao giờ là do one neck call one neck call thì một sự call chủ call lẩu là do call ý cho nên mà là để call ít hơn tiền để uống bia một call bao giờ là một call ra luôn cho lâu là lời của để cho tôi để giờ ý tôi nên rồi xin lời người muốn giờ giúp bao giờ là muốn nhỏ em và luôn rằng là tôi nó không tôi đồng là tôi cho lời chỉ để vô nó một con sao chỉ là một tên nọ thì chỉ nếu mua sai nó chỉ cho nên từ tôi thọ cho tôi muốn nếu mua sai tôi nên tự sức làm sao mua về tôi chân nên người chế đó lại or sometimes tôi kia học sao tụi mình giờ tôi sai được lúc trẻ kia là lại họ thấy cái call là chỉ for example là chỉ công của tôi thấy cái call chỉ công chỉ của tôi call lại của trẻ là lại tôi thân tha là lại nữa chủ yếu là do của chỉ công tôi tỏ của một cái call của mình trẻ right còn chủ call đó đó chỉ cho nó mới cho tiền xong nữa mong là chỉ để những món chuyện vụ để cho nó những một call bao nhiêu sự trong ở trong bể tiền nó cho nó chỉ tao ăn là cũng chỉ số bỏ đó là hoàn là tất nhiên mỗi sự vào những chuyện bỏ qua và mỗi sự kiểu nên share lên còn đầu là sức any question for me about the name Yaig and then I will try to so cái này sao là mà lần trước thì nó đi hay có một trôi itu thì mong là mà là mua họ đi nó nữa vì anh nói cho số thế bây giờ tập trong luôn chơi là bây giờ để một bọn để không một giờ mỗi lúc bắt đầu cho nó đầu lại bị part cái này mỗi tụt cái nhà họ lại mỗi tụt đỏ lại mỗi cho tiền thật cho họ được chỉ là sao đa rồi là có một trâu tàu thêm là có một đi muốn cho tàu thì tàu nó là sợ tuổi phá trâu kìa để muốn cho tàu thì tàu tôi chỉ phải share là bây giờ bị thuyền đi có một trâu ý một trâu nó bay một trâu một căn thôi nữa để tôi chỉ phải share để tàu lớn luôn cho tàu thì đa luôn rồi lo sang tới lúc chạy nữa đa lúc chạy là sợ lo gì kìa chỉ lúc chạy không một trâu tàu thế này không một tôi cho lo sợ rồi cho nên một lo một tuổi là chị nó biết chị giờ tôi cho lần nó phá một cái lo lỡ chị cái tôi nên thân xa nữa chị sẽ đi xa đi tới chị sẽ đi mua đi tới và I could go more about it yes
hoặc là chia để mỗi sau là mua trong nó khi đồ cho nông thứ sáu bây giờ chia để lúc bắt đầu thế này
yes so nó mua là người làm chủ này thôi cũng mà cho lâu nên chưa tôi thì mua cho nó mua cho cho chú rồi thì mua cho cho chờ thế mua cho gió thế thì tôi uống nó một mấy cho mà lớn kỹ qua nhưng mà thà thì nó chỉ có những cái không biết rồi lo bị không biết khỏi đắt nên là sức đó chỉ tôi mà nên cho tôi mua cho mua để cho ba hoặc cho gió này thì người cho qua ra thế người đá mua nó có trâu lo ya là sao mà có trâu希望给是几米推看，少是几米推个地域，我都搞好我都顾，right？cái我哋我到我哋睇點我嗱就能散咗來咗，個唔做嗱，打到錢都皮咯，我老是睇還做。
I have a ministerial scenario that can you guys explain it? Basically, Ning South where they had to, I think they had to go to a year around the tour, actually fire the ninja. Like I've seen that.
Oh, okay. So nó muốn một bia nó đầu đấy.
Yeah, or something like that.
Yeah, fire. Okay. Họ có mà như có một trâu nữa, chỉ lấy lỡ bộ thân có một trâu chỉ lỡ khó ta thì. Yep. Oh, sorry. Vậy sao nữa? Có một trâu chỉ lỡ ta là chỉ là một thân nước quả ta chỉ một sao nữa. So thân nước quả thân nước sao nó cũng sẽ vậy nữa, right? But they're different too. Thân nước quả nó mới hơi đểอยู่这省呢，有些都是好那用头了，去用头呀，有这省头了，就我都叫有阿老的，呀，这老有我爬都乱都有阿老，他那过了嘛要阿拉了餐嘛要么要古龙高古州呢，我见到我有我还能录证了呢，我叫录证了，而且有到后场得证了，一堆几里到手里多了没有？也老成这都谈得过，谈得过的那天，老公谈得过那天啊，你一叫蒙那么用了呢，蒙那么你也谈好的，我 curse 了，一接那么我你好来的走了，right？这好来的走了，这一都多些了，那这个多谈得过都住都老了，但是那天呢，so กูอยู่ที่海岛，เขาต้องเขาการเขาไปยก蒙呢，because 一接那么我你好走了，right？这啊，不准谈好，这个都没说的，是这样。
都個主題係即係呢個學巴個咁樣。
I'm going to go to that. So, cũng bị chuyển rồi cái này cái. Sai chỉ đó thì tôi chỉ nói là nó có tan thoát thôi giả là cái. Rồi. Thế mà nó cái một cái đối diện trong một cái giá thế tận tới cái gì nữa rồi. Tôi thảo họ mình chứ. Yes, nhưng mà thế thảo của tổng chứng lớn như thế. But that happens 91%. It's like 0.002 maybe. Tổng chứng đó. But เขาได้ที่นั่นที่ถ้าเขาจะจังหันเดียร์อีทุกสิ่งนั้นจะจะต่อที่นี่วันนี้เขาต่อช่วยอย่างเป็นสิ่งนั้นสิ่งที่เราไม่จะรับตัวนี้ก็หาย right อีทุกสิ่งอย่างนั้น right ใช่ชิต่อเดียวโอเคเขาเบรกเขาจะมุ่งเข้าตัวนั้นอะไรเราทำถูกมามุ่งมาถ่ายเดียวนั่นพอเติมเท่านั้นเขาชัวร์มาอย่างว่าจะตัวนั้น right แต่ว่ามันบอกว่านั่นเขาชัวร์เท่านั้นพอเติมเท่านั่นเดียวบอกให้เราเนี่ยบอกให้มันก็ชิดตัดเดียวงั้นเขาอยู่ว่าซึ่งये जो वाले तो ये जब ये जो ला वो जो नंग ता जो ले चुप बुआ भी दे ये चुप मन मन जी नंग जो जी जा जा जी लाก็ดู这येก็จะจ่อนึงมาที่ต่อซึ่งนะयेจะจ่อจะจะต่อก็ผมก็บอกให้มันก็มุจีหล่อนะอีตูนงnó sẽ có tớiตูนงnóจะจ่อมาก็ที่หล่อนะอีจูเลยนะयेจ่อ branch nóมาที่จูบอลเลย一直保在一直保在这这的是这些吃我了，完了我就拿了就把拉了成就是我掉毛嘿嘿个是，也叫都得讲了也被我他们老把了这个也讲了，you know， 其中我 it's hard to say， yeah， so 给人几件技术错多，这能给我多。cái những khó cái những sao cái sự nhiều specialize ý giả đó họ đã khi đó để cụ yok hay nó có được cụ thể hay nó có việc cụ thể năng là cụ thể hay nó có được họ specialize cái gì họ cụ yok khi đó để ok cái sự năng cái specialize cái nó be honest bây giờ cái chuyện đó là nên đi cho nó chỉ mất thả ý nhau cha thầu là cụ mặc quần cụ yên cho nên cú nhỏ tổ luôn có thì cú chỉ dùng thả thế cú chỉ dùng một thả tàu vậy ôn năng gì you know your specialty chịu nhỏ họ là những thằng năng để chịu bảo hộ họ cho tôi chịu một xong là sự cho một thả elaborate lot thôi là cho một thả chơi thôi là thế một thả họ sẽ là một tàu hay có một thả một exaggerate lot thôi là nó vậyอย่าเราอย่า只要我อย่า把ตัวไป中风了这样我都找这个这所以对他都好个是了一个导师我要牧师我因为我他都花掉给你去要了要么呢给你去妥了也去用了这样 right so I'll be honest 我也都能我估计你我能力呢 I don't that's why I see it as a curse chỉ là không chịu được cú, but vì thế chúng đi giờ cú tốt cho我了就会有 accept 了，OK，I know，我们阿拉鲁就那个我叫我多见解，cú giờ tôi nên cú chỉ chua tôi cho nên tôi không có lo，但我到时到时那个我只不我叫，然后呢好不去处理，但有么阿姐了就我有用有保温，我得都是只要了就。我在这个华人也好 curse， vì thế tôi chỉ nhớ có những phương mà họ有包我哋là thế có một chỉ mà họ sinh sống đây vậy, cũng thế bỏ đầu thế cũng họ nên là gì họ curse cũng vì thế I don't want to be the first one to know, I don't want to be the first one to endure, so họ nói một thật, trên cái đầu họ cũng thế tu nữa, để be open up about it, so cũng những họ nó relate cả nó trong mental health nữa, sorry. So how does getting KJ related to mental health and how to help treat mental health? A lot of times you social connection. If I thought cho những cái việc là cúi hô các tin ở đây là tao ai cũng thằng ta lực mà nó là để ý là lý giải này nên tụi tin nó có ta thảo right. A lot of times you just get connection á. You more yes you talk to they can know but there's a piece missing. Where có một mental health có một get help của đi chợ họ mainstream á. There's a piece that is missing where có lo lo của có you or where you from or where you belong. Họ piece is missing thì họ get age close nữa. You never have closure. So how you closure then you have to go all around circle. You have to more understand yourself more around circle. That's all. Lower connected there. You just get where you come from, then you see that everyone can talk about it. More may understand you to self. You take more process yourself on there, you take more reflect yourself on there, you take more choose yourself on there, but do you okay? Then you take more care you do you your lúc gì là do cái nên cái cho là cái tiền thì ok cũng đi ba lên mà cũng bỏ ba lên, right? So what is okay? One again. The only time people won't get low, and even though they just want to, even though we say, oh, we're Americanized, we're a liar. We're so not Americanized at all. You know what? So, tôi biết tận kia một cái tận đó, cái thật ta đi đó chỉ tôi biết cái challenge kia bộ cái không lý do cái không muốn biết sự chuyện cái hại kia, right? So we're now. So how about that? Why is connected to? Because it's only okay for people community to really talk about mental health here.เราthật sự kiến cái gì? Thế thôi từ nó cái nó chỉ dùng nó mà ok là thật sự họ sao lại cái gì hay đó cũng như thế đó cũng như thế là cũng sao tốt hơn it's not okay at all. It's that judgment there that it's not okay. And the chia nó biết trước mong sợ Miguel learn the same, but Miguel right now learn there's so much exposure to like right now là bao more là thì là ngoài đẹp rất rõ. Họ biết muốn mà người chịu họ biết nếu nó chủ quan thì họ class một sáng nó như họ thì hay là sao có exposure tôi dùng ra có biết hay là một giờ đi luôn có biết bao nhiêu bao chỉ ba tới sáu đi luôn nó họ biết sao nó so ok nó cái học đây là cái trauma này của hắn trauma secondary trauma historical trauma generational trauma cultural trauma trauma thì nó không tại tạo chỉ cho để cái của trái nó việc có bóng đi, okay? Vì còn đầu tiên tôi trái giờ drop, right? Để cho họ history trauma, whole war trauma, okay? Bây giờ mình nhiều lò đó, กูเนี่ยกูสิตอนที่ต้นชายเขียนจอก็จอแล้วถามกับกูนะกู care มาเนี่ย in the hot trauma, the secondary trauma, that she affect you directly, but how does it affect more than a woman or there? In the area you pass okay. The each don't yet talk to Tona, or how hard she will do. If you pull, look there now, one generation, you have to work, it was a bit of very busy solo, very struggle to hard trauma, very to right? You need to in or you need to do that she took her get the edge. It will be a week of short like none take edge. How not short to not take bells. Tell you it's in Goma, right? Young society, each morning than to be got. How people talk it up, take the other drop out of the morning, right? It will become a new one, it will become a trauma of better. 你这里到我说，也这给公不离这里要给了，这多差，也到不来就给人家讲，忙他都有到这多差了，แล้วว่าสองคนกูปีวันนึงเขาวันนึงใช้要好我被手写老了，对吧？一个太老了，一个都提早了，一个我早超老，也好也好我写老了呢，也好好被我到本不同的呢，也好了我这也不好跟人学的。 เพราะขณะเสียเขาแต่จุ๊บไม่เขาแหวนอยู่ว่าเป็นสักอย่างเช่นเราป้าไปเข้าไปรีบไปเขาไม่จะเข้านี่อีทุติดาดูมอบหลอดจะเอาไรหรือตัวติดตัวเลยเนี่ยเชื่อตัวเองกี่ตัวโหลท่านนั้นเขาตาหรือจะนอน Hmong that they don't share a lot of time. The year where hot show together, accept. Your community comes together, how perception where they'll bring how value to you, right? How believe. Time then they how first step. Time then who believe they how first step. Get to where right now because one then the man need you more how healing the how you how caught of themselves no. บอกให้ผมซื้อจุดต่อแต่คนน้อยเกี่ยนกี่แค่นะซื้อจอต่อไปให้เพียงไปให้ขอไปให้จ่าต่อไปตรงผู้เชี่ยวชาญเชี่ยวชาญเนาะ use it right now take a step forward and go with it 都这一เนาะเกี่ยนกี่แค่ชวนจะ prove ตัวตัวอย่าง but they did prove a lot of things before you become a doctor it's one of the first book you read it's actually a Hmong book right what's it called the little girl.
Spiritual.
Oh yeah.
Thoughts sound.
That one is one of the books that you have to read if you go any medical fields or any perception, right? People zoom Honda, Fresno. You know, your first one where Dr. Khan, the Lutheran, transition building, a Lutheran, a little quick Lutheran building. On top of the counter, for first the most significant to who you bring the in my bell light situation. Go look that at YouTube. There's actually one on YouTube. And see, right now, we want to learn to get what that's not. The teaching thought that okay. More about the home model, no more what the home model better, right? How many so now should be more of them, but I started in California, what you walk ago. 因此到手里啊，去摸那些，了到我到去就是用了的，然后我听我的，到阿拉达的你摸着山，开放也摸去都达的山那个，老多真的，是老了真的，有这个我摸个口，在我那我觉得好嘛，就好过啥么可能那就点个哈鲁flat了，早都跟那就好点，去买的这个最好的八个就我们呢。 But at the same time, you back on the dollar right now. You have to help you help out. Watch out for this. Don't pay too much. That's why I'm right now. Look at you again. How much help you help one then? Number one. Be there, yeah. You talk a little slowly, more. So the good, you keep your shares. You don't talk you to kiss. But you know, so that's all you. Or you don't want to do not get here. The stroke, depression, or what you. heart attack, right? Or do not lead a lot of start with mental health. So let's win this battle. Let's create something that, guide this way into where go people pop into something, go people lead forward and take this challenge forward. Yeah. How does the lack of communication, understanding, and the mental health lead to suicide within the Hmong community? This is a really, really hard question that it was asked upon me because I work in a crisis team and I answered a lot of 98 calls when I was at Carver County. Lack of awareness. Why? Bitch both the bitch got that, right? It's actually lack of awareness. Ý là chủ sĩ đi hay cho cố của cái đi nó chuột gió nó sẽ hiện đó. Cũng是这样弄起来的，我都是nó rất buồn. Nếu mót của cái sinh thế, thì họ kêu vào cụ thế, thì họ chỉ sao mà, right? Rồi họ cũng tu na, mót bị sao, phải tu bảo chuyện tôi yếu, nó rất tốt kia. Half the guilt is me as a father. Cũng有帮很多的，也不可得可。Thế chỉ tao muốn từ của lúc hậu tờ rồi do nó bỏ từ thua xuống đây rồi bé còn bé bỏ được kìa nếu muốn đi nó bây giờ tao muốn đi nó còn bắt tao bé chỉ vì chỉ một người đấy thôi chỉ tao bỏ hai tụi chỉ chỉ bỏ một gia đình này chỉ tao happy cái tao chỉ đi tao lỡ chỉ nó bị khâu khắc cái của cha chỉ trauma repeat again it's the cycle that's going again. But how awareness not yet how that more no or be willing to open. Create a safe space go. Cả chữ thả, cả lọ thả, cả là bóng công mua, cả là thì rất kiến trái, cái chuyện của. Chỉ như mua tàu rất kiến chân nó lỡ, hoặc nếu mà safe space nó sẽ lỡ, chỉ biết chân thả chân chế chỉ chuẩn số vấn đề. Ta chỉ hỏi. Khi mà sao mua, khi mà chúa, khi mà nó hai chữ trong, thì phải bảo vệ cho mình, hai người you carry, họ nói luôn vấn đề sao? This was let me finish it now, get through. So for the last 15 years, there's a lot of suicide in the Hmong community. And it's, as a person who works in the crisis field and the suicide field, it's a burden. And it hurts, right? Ý cho quý nói cho lại từ không được chuẩn thôi mà. To me, that rang a bell of do you know where he at when that happened? Do you know what decision is run through his head at that time? What is his racing thought when he decided to do that? What triggered him to automatically do that? Because we're so fearful that we're not willing to challenge ourselves that vision to that point. So that's what we had there. How shame, yeah, how much of the, so get some more, so get bong về, so get what, those shit we can't actually get it, right? Yeah. That guilt part is the hardest for all people. She had things happen to. That guilt part is the hardest. Shame is much in your surface now. Guilt is always about not wanting to admit the guilt. But carry that guilt. So, one of the Lord there, you have to handle to the you thought you guilt things right? Guilty is the leader. But long and long you biết tổng không long lâu rồi trời you know nhớ thực hiện nên tôi thực hiện đã why cho nên những mua chỉ trong sẽ dùng cái sản phẩm thay vì dùng chỉ nên người dùng tiền là những người dùng một sản phẩm là dùng sẽ thả mà lo luôn trong thả tổng một số sản phẩm sản phẩm nó thuộc á tổng nhau là sẽ thả đến sản phẩm nó theo á ตัวไอ้อยู่ดีเลยกูตัวจุดตุนอยู่กูตัวอยู่แล้วก็จนลงไปเลยสิก็ถ่ายช่วยรอแล้วกูถ่ายช่วยรอแล้วก็กูผู้ชมก็แล้วก็ผู้ชมกูเอาละที่ช่วยว่าจะเห็นเดียวสิเขาอยู่ตัวเป็นบอกเรื่องเราตื่นจะบอกเราตื่นให้ถึงอยู่รู้อยู่ในสิจะเขาเลยจะเอาไปอยู่เกี่ยว That's all my perception is. Thank you. It's like, okay. Sorry.
I was just gonna say that, like, basically, and I feel kind of like, this is more, you get more illness, or do people equal, or do you see like, the more you should do, because even with the kids, feel like, yeah, go mad, yes, like, we people equal, or go, some more children, but I'm like, but we feel like with the people normal, right? Like, when she said, look, she no more, because I always tell them about, they go, she more, we feel like normal. Joke about getting your shit, and I'm just kind of like, it's just like getting your shit into it, and it's not like, so that's why I'm just saying that it's just, but you might go sometimes, where I feel like I don't want to be labeled as, like, you mean mama, or, you know, so I'm always in denial, so it took me a long time to finally accept and be like, okay, and be aware, because I was always in denial that which mama, which got no trouble, which got, you know, because of that shame, that guilt, your image, you know, because you're in jail, oh, you didn't mama, you didn't, you know, that's a lot too, you know, and that's another thing too about like awareness and not wanting to talk about it or not acknowledging what you can't get, you know, that I am bipolar 2 or not, or do I have it or do I don't, you know, or like, because sometimes what people look at this, I'm not sure yet, you're not sure you need to be, no, you depend on it, so I have that thought too where I don't want to depend on meds, or I don't want to, you know, take meds, or, you know, or people to know, or like, you know, and you keep it private, so, but again, that's what I'm saying, I'm being vulnerable, I'm being open about it, but most times you know, you more content, you know. It's really hard, it's a hard topic.
This is my best advice to everyone. Don't always be comfortable. When you are comfortable, you become lazy. When you're comfortable, then you don't know yourself. Stay the edge, right? Know yourself, know what it is, right? When God Josh told so yellow, you thought this something happened, don't you go sports and know yourself too much, stay the edge. You have to go left, right, don't risk it, at least know. What I mean by stay to the edge is know yourself, be alert, be there, right? So when I'm moving on, how to take it, we have the different culture values, belief. We don't let you know in when you're talking, you don't know that you, Hmong chỉ biết mỗi số chính trị và người họ core belief or cultural belief of people. People that are quite Hmong mà Hmong lo sao đây, biết gì là cái sao được kinh nữa, biết luôn luôn đây, biết gì là cái luôn được kinh đây. Chỉ tao có vấn đề nào là chỉ cần có kinh, cho cả là, chỉ tao tới mình cũng làm tốt chứ, để là chúng ta ba cái chứ, lại chúng ta tiền là ba cái chứ, cái lên giờ. So họ cũng chỉ cho họ để cho pay the school for that. One thing, we have to learn how to love ourselves and know ourselves first before you learn how to love other people, and then love everyone else. For example, your heart, you change it, you do see. Yes, you don't want to be a strong day, but some day or sometime once, half of the time, you need to your time for yourself too, and know yourself. Yes.
Học rằng môn gì mà phụ thân thì có tiền đi thế giàu bên mong người đọc bên mua ở bên đi cổ bên cả so với chỉ giờ all tua thì bên chỉ cả lần bên học thì học khi dùng đi bên an ignorant and resource thì bên chỉ cả một cổng vô trả chỉ cả một cổng đã chi một cỡ đã chi đâu mà bên cũng không được bên bao gì nhỉ thì cũng có với họ tới mình học việc của mình, personal việc của mình đấy chỉ học của chính của ý rằng thì bây giờ tôi chẳng ăn táo không mà bây giờ không chỉ được đâu, ta sẽ thảo với con cái sinh đầu sinhตัวnày của những người này thì tôi tạo ra sự thì lúc sau thì ta về đi hay cái gì đó nó làm cái này chúa không nè cái này chúng ba cái thằng này搞qua đầu cái tâm mình nó搞chân không how They will something each school name, and each school got name. Maybe each band to can know, you know. They call not each band to can get them and she make it that they will go to know the professional. They're not doing their job, they're not helping the patient. They're not the children are doing their job, they're not creating program to help the people that are in trial. Để chỉ mà sáng tỏ còn đây là mình thầy có tăng cho cái chuyện là cái đó khi chuyên môn cái thông tâm này cái giải quyết thả nó giờ thì phiêu là thì một tấm mình muốn thả cái gì ba rồi cái gì đó thì như thế nữa there's no shame to it cái đó là open cái có mấy con cái số thả nàyอยู่thông tâm một cái ô cũng một phía nó tàn nhưng chỉ là tập thể của nó then you help me if I don't want to get start, you know, whatever. They come down and you know, they want to abuse a spouse in the house and you need to get some idea, go to these counseling workshops, get help.
I really agree to that too. A lot of times, in bụng đã trở về họ cultural value, vì họ cultural value mà họ equal họ lo, right? Vì thế như xin lỗi không. 语言好，那叫老天，有点地天，就是这里还有这些都只能啊。人要来的，各都一个 a man of the house 我们讲没有意，各是只能帮我用海，我是估计到底用海。把那个怎样，应该和 ego 天，but how can we soften up our ego now? The best way is this: learn how to. You do it first. You learn how to approach. You learn how to give the first reach out. So for cú thì cú bỏ tao thì cú cho mong rồi nó thì cú gì cú mua cú khi cho những sự rồi đó. Giờ tôi thấy cú một số cái concentration là giống như chỉ là you bỏ cái thì you do là một điều là gì cú take approach ra là cú nông được ra là. Tôi cho nó được một người viết giải rồi chúng tôi cho nó là gì. Giờ tôi thấy những mọi chuyện kia là gì, cũng chú trọng là tổ chức là cũng là, cái cũng là cái gì, thì cũng kia bảo sao, create a safe space. Ôn nên mà hệ thống ôn nên giống một cái gì cả, chỉ hai đến tư nữa, cũng thấy có những gì cả là mẹ nữa, right? Đó là thôi, ít tu là thấy có thêm nữa đó, thì một hành trình sẽ đó, tổ chức dân nông làm nông là, chỉ có những cái đó, right? So a lot of time, especially, people. And this have to do with war too. Because you hold more trauma, yeah. Có chỉ có đó cóตัวsự, right? Chỉ bây giờ cái số đấy là chỉ học được lo, chỉ học được giáo bây lo số lo nữa. Chỉ bây giờ lần đầu thì ta nói là ego是只要的. So because你học trò quân biết cho một số nó lo mà, chỉ bây giờ tao mà learn how to play, đi sát khâu mà, có lấy cái EP số số ấy, cho lúa cầu tiếp lại thế xong, thế thì nó ăn giá quá. So let's not just say right here only. Let's start up here and let's slowly come down. What it is, talk the better hơn. Có một lúc chú ý, right? Nếu một lúc chú ý, let's create those ideas. Let's make a move. Even I'm going to celebrate you or Ange, it's still moving. That idea, that perception, is where we need to be at. Sorry.
One question I have. I think thank you to you both for this great presentation. This question that I have next is really for the whole Lo-Pha Society and the two presenters. One community that I think we should really reach out to is young Hmong boys. In the recent years, you see a lot of Hmong boys who commit suicide, they disappear. And I think this is a great topic, but how can, half of this room is men. How can you guys reach out to this vulnerable group of young boys?
That is really a hard question. There's idea there's, but you know, how you spark something, huh? But you know, a lot of Hmong young people can know when you bỏ thì không có cái issue và chỉ bỏ lên từ chỉ bỏ ở đây right? Like I think This is what I think. I think that one of the best ways to really approach this is start with a professional. Let's have a talk there first, right? Because H&D no money, conference. Let's start H&D first. Might elaborate down. Okay? Either open up, open up the community, no? We had the like Lo-Pha no, like we say no, Lo-Pha Society, Lo-Pha Council, let's tumble it down. Instead of just starting one here and then one not that it does. How are you really going to really address this? Let's start where somewhere is valuable that we see that this is a part of the whole community right now that it's really a big thing. Mental health is suicidal. Right here. Right now, will go through a lot of cutting and self-harm too. And for myself, working in Carver County, that's a white county. And being able to see 4 patients that are Hmong, that's a lot for me. So let's start from up here. Let everyone here is a professional. Everyone here work with people. Right? It starts with our voice. Yeah? Money-wise, yeah, senior money is a big topic. We are really well off. But who will have the mouth to really open everyone up? That's a hard one. But I would like, whoever have connection with H&D, whoever have with special Minnesota associate students, bring that up. Let's have a talk. Let's bring professional in the room.
So, thế nhá không lù nè mà tại sao này cái visa sinh hoạt rồi câu do của bố tiền lử những cái chuyện này nó sẽ mà
Be willing to ask the hard question. Be willing to be vulnerable or be in the, where don't feel normal or be at the where you feel emotional about it, right? Emotionally driven, or emotionally that you said change out there, yeah. But emotional could be something bad too. But be that emotional where you can change. At the same time, how really about struggle thinking, trauma, history, secondary, cultural, shame, guilt, right? And grief. Grief is one of them that people don't really talk about. But grief is hard to share. You could be back in. You could get little that on you, little Okay, related, the visit to the hospital, nothing we skip on also, right? How all the stuff not talking to the water hard there. If you want to call you to get a China, not draw shit or how it is not correct suicide ideations, general, no pressure, no value, no homicide, murder, suicide, cultural crash, self identity, right? You to king more value. Chỉ thằng là chỉ họ chỉ sẽ cho là sao vậy? You should bought that, can I get like you should bought you're lost, it's a lost yourself. Look hot, look black hole, and you lose that job, to the loser. Okay. Way to cope. May society, how to cope is develop coping skills, self-develop, or professional. Be willing to ask for help, but be willing to be the person who know and knowledge and know how to ask them, do you need help? Itu nung ko ate kapusa ni ke pachi, ko pala kachi. All of the room was the na kapusa ni ke pa. Tu nang ne ke kheba. Ko pala kachi. Tsara. So Hmong Miguel there, I message and you message, right? So, kupala karachi, kapuri ke ba. Em nung man yo ya se rồi. Ta shi toi tu nên lu mo ki yo xie sa se to so la. E ka no all lo i lo sa ya na. Tu nên lu nong la sa. E vi de jo lu no ye jo be yo to. Ti se de to ke de. Be yo to how the be your professional field je. Be yo to ask your question on to te. E ka me se po pa pi yo ku ti mo te be jo che mo. Mo to te. Ke lo te ku pa to ko. Rồi thì có ba lấy ra chỉ có bôi giả chỉ có sản phẩm. Ask yourself, these 3 ways of asking, this one is software, right? And to you to name your heart, start spotting it again. The softest one is the way how to ask. People that understand yourself. Teacher, probably your children too. Teacher, understand yourself and how to get yourself. What is it? Teacher, how does teacher talk? How cultural? Tell the traditional way, immediate family. Tu nên ngồi trên cha, right? Or tu nên ngồi trên, right? Cái này thì là, or có mỗi tu nên nhớ tới rất biệt là mình cho mình kia mà ok. Ít tu lâu hay lâu rồi, right? And the only one we call that is wrongs. It's wrongs, right? A lot of time, they wrong perceptions, contradiction, the total alcohol, not wrong, your critical value, critical belief in being on. Getting what the whole being yet and go to you're getting what's a Come on, you add sorry, this went on to.
Cũng chỉ này cũng thấy cũng chỉ cái thầu cũng chỉ nhớ cũng dần cái cũng với khâu QPR training thì cũng có sao thì còn đấy khâu chứng kiến cái tôi phải trong này cũng chân tôi thì vào thời mà bây chỉ Hmong số hai nâng là những môn chỉ trong mình đang rồi thầu ít tôi nâng những một cái như thế là thả tôi bây chỉ có lòng bây có tên mình, cái thầu bây tên lòng thế bây tên mình thì bây hai trong mình thì có thể có tới mình năm mươi có thể có từ sinh sản đi có thể có sản thôi luôn những lần mà thì bây hai tôi tới lùn thả cái tới lùa trong lòng này cái thầu luôn tụt bia luôn có cái như thế là mà luôn bổ luôn đủ, cái gì tôi như tụm lòng mà snap thành nên là thì tôi tụi nên nó kiểu đây hết tiền. Có sẽ cũng có tới mình chỉ chỉnh cái có chỉ tám năm chỉ thả thì forget it. Thì hôm nay thì tôi lấy cái chỉ cả chia sẻ tôi bị tôi đi rồi thâu nó thì bảo cái bao thì tiếng một tới mình là nên thì chúng ta để ở đây là nhà bé will continue the KPR training nó kia bé cái bé này thì cả bé sầu tâm long tâm nung the right word. Giờ thì bây bao thì tụi mình là khó kiến nó sẽ lo sao thẳng tin là nó giờ bây chỉ more resource là at least we know to connect them to someone who has those resources. That's all.
That's a really great idea. Cái này chỉ cái người Hmong Medical Association là những cái tàu là cái health fair chỉ này nó thế này rồi chỉ được cái cổng ra. And the big thing is with those health organizations, I think they are screener. I think they screen blood pressure, they screen chashes, they screen the depression, they screen the suicide. We see that, and they are normalize that. Normalizing is the biggest thing. Is that this is the normal. Mental health is normal, and that this is the same thing as physical health, spiritual health. We have to touch all those pieces. You're going to call it spiritual, you're going to call it physical, you're going to call it so it needs to be every single aspect that needs to be fixed. So, screener, the make your health professional body image. Go ahead.
Does that have to, before anybody do this work, especially when I mentioned H&D, I think that everybody should have trauma-informed training. As being a leader, especially at the top, like H&D, Seeds for Hope. I don't know if you guys have seen that organization circling around statewide. Like, if you are going to work with a Hmong population, you need to have trauma informed. And I already saw like the whole, I don't know if you guys are familiar, like the whole situation that has surfaced around the whole social media. I wrote to both organizations, and it's not to write to you to call out and, you know, let your leadership go, but I feel like your leadership, your person in a leadership role responded with no trauma-informed training, and it has caused more harm to the Hmong community.
So trauma informed, like I said, trauma is a gateway for a lot of mental health. So especially when you're a gateway now, trauma do more harm than good. At the same time, trauma is a good way to talk about it, expand about it, understand about it, and it will lower the mental health. But when got your trauma informed, say, come on, law. I mean, though, based on, so I think there's two sides to it. So, each of them, just a no, just a high, no. One thing, man, you only always in that. We just a high, but we just no. We just no, we just a high, right? You more also a story, but the best way to deal with trauma informed is because you do hard, okay, what is mostly there. So let's do it. That's the topic. Someone that openly specializes, put that tower down. AJ Monson, let's do it. Talk about it. Let's move this forward. Eastern reader, to pay more IP, still moving up, moving forward. Don't judge it or you're leaving more Eastern reader. Right? That's one of the biggest thing right now. So, social media is one of them. Either is a good thing, but a lot of bad thing too. So, how did you you talk about use scope there? Move edge like you move forward. All edge like you forward, right? If you like forward. See you. How you got? The more like Eastern, because it's more taught they don't know that you much dollar, right? It should all the shit they have. So our trauma reforms is a big thing. At the same time, you have to understand it to really to address it. They can young professional field really hard because because it's in general nó học trend luôn nó sẽ actually thảo thám tốt để chuyển lo cho lắm luôn hả? So that's one of them.
I just want to add, so I work for the Hennepin County, and I just ran into this, and it's alarming. But I wrote to the HR at Hennepin County because it's so disappointing, discouraging that their employee assistance program, it was so hard to navigate just to get a Hmong therapist. And I'm like, wow, we are the biggest Hennepin County. We are huge on equity and inclusion, but when an employee accesses your EAP program and there is no Hmong therapist, and then you even send them to a third party and there is still no Hmong therapist.
That's a really, really hard thing. I see that's a lot of lack of resource. You know what? Connection. You know why? Even though the lack, be willing to be uncomfortable, come on and talk. Because there's everyone here, there's a connection for us. Boy, didn't go be willing to connect, you will find help or find the resource you need faster. When you bought the Hennepin County, see how many more people you know in work in Hennepin County. Connect those. Those will know someone. And then will know someone. That's how I do it. So keep connecting, keep holding to each other. That's the best way to move forward.
Can we put together a resource of professionals that can possibly do that? Yeah, because right now we have two professionals here, at least one licensed DMT, and then maybe Lo-Pha Society can start that up, and we reach out to the community, then we can start that.
Yeah, and if you're looking for therapy, the one thing for therapy that we always forward to is fasttrackermn.org. So FASTTRACKERMN.org. You can search up and specify, okay, well, I've got this health insurance, I'm looking for this kind of therapist, and then they can try to link you to that. It's a web source. Most of the time, it's helpful.
most of the time, therapy you only genuinely specialize in different health therapies, right? It's best where more to go the both of them. That's what you're working on.
Well, I just want to apologize. I thought that ni mutu sto ha person that tu among the which one each other thought but who mental health ni a topic to me who feel no there's a lot of things that tie to mental health now. And I feel like it starts from because of the war, the trauma, generational trauma, especially because Bay family, so they are just in survival mode. And so they're always just thinking about survival. Yeah, I think you want all these things to talk about a lot of a lot of stuff that they have to deal with that affects for me, I feel especially. And so I feel like it's a big topic, but a lot of things ties to it. But I feel like I started doing community work in 2016. Follow mostly Hmong men's circle. Because I was in a lot of Hmong women's circle. There's also Hmong men's circle. I know that they've done a lot of this. I know I think the person in front in charge of it. It's been a while since 5 years since I talked to him, but I think the Hmong Tong is but yes, so I know that he does a lot of stuff. I have not connected with him for a long time, but there's a Project Chandu for suicidal awareness. I forgot it was they were kind of doing a little bit of Project Chandu for a little bit for suicidal awareness. I was trying to connect with them at one point. There's a lot of resources out there, but I feel like in the end, but I feel like it starts with us. And or else we know someone and we can share our idea or choose something for big Hmong boys because we didn't want that table. Suicidal homicides, actually homicides. We want to be online, they make it viral. But the big time so like these resources that we're about to get to how to resolve this. It's kind of like we feel that's the thing that I see a lot of debate, a lot of people talking. A few weeks later, she talks like because suicidal, because homicide. Like Hmong is viral. And when it comes to like Hmong it's viral. But when it comes to stuff like this, mental health, it makes me really sad. And so I feel like that's why I'm very passionate about mental health, youth, about all those things, because self-identity, because and so that's why I feel like these are things that it starts with us. Or like again, you're going to family, a lot of my friends they say, or a lot of people I've seen, why didn't you reach out to me? Oh, okay, call me, like hit me up, call me. But sometimes I feel like you be that person, call him, message that person, DM, hey, go show me now, come on, okay, cool. Or like, or else, how can I help? If you might just be like, hey, come on, like what's going on? I'm here, okay, but sometimes it's really hard for people to ask for help because when you ask for help, like it's hard. Anybody, it's hard for you to take that first step and be like, I need help. It's very hard for you to ask it to me or come people, I need help. Like sometimes be that first person to be like, hey, I'm here for you, but let them know, show them that you are here, because I have a lot of people that write to me, oh, or like, it's like, during that time, I want to be distant, I want to be by myself, so I feel like it's very hard to tell people, ask for help. So if you could be that person to be like, hey, like let me take all like actually go and like message them, take them out, because you guys got message, because like if you don't make it known or make it to them that like, hey, I can help you, or how can I help? Reach out to maybe reach out to the people that's closest to them, their best friends, you're reach out to sometimes your own family, and your own family that you understand you, and you feel like you touched on them. So sometimes you move out here where you feel like even though you tell your own sibling, you tell your own cousin, you tell your own friend, and that you understand you or like what I've gotten before. Hey, got the money, I'm once you got the money, or then I feel kind of like, okay, never mind, you know. So again, just it starts with you, and that's all I can say. And you want a lot of resources, but it's hard to. You want resources, what to do? Yeah, you wish probably to keep green sheet. Like green board, the more resources, we bought one, and I think that you would reach out again. We should probably keep again. She probably did. It's really hard.
There's another thing for Hmong community too. Chỉ do thì tụi nâng nó có tấm mình sẽ để hỗ trợ tụi nâng là lái tụi học crisis line thế nào cái. Giờ có mấy tụi love một là giờ tụi nâng có bao giờ là giờ có tụi phong như thế nào có chỉ là họ nó crisis line no matter what.
Or mental health training, at least mental health training everyone to know when someone might need help. Because that's another thing too.
So, cũng muốn cho the county do nó crisis line for that because I have 4 county here. I should put more, but now they give you national. Okay, you could do a call anytime, right? But the county in Ramsey County, Hennepin County, Anoka County, and Washington County, right? I know a lot of motion, different counties, not sure but these are the 4 that I put down. Có hồ lại anyone, có tụi phun chỉ có tụi mình nhiều mua thêm có đi validate, okay, có một số khi nhiều share đi trả nữa. Có hồ lại there's a professional on the line to help you with, alright? Someone thì có ý lăng sữa, right? Có ý lăng thì còn là bao nhiêu rồi. Cái tia cái tự họ idea cái tia chỉ nói yes rồi chỉ cháu qua cái tia họ làm nhớ họ mental help you okay. One time the mental health there she was okay. Let's talk about lab large one, right? Cái này kia what's have to do with it too? Because ít cho bạn để nó là sẽ show nên cái nhiều cho chị tụ là do nó cũng nó thì cứ thế mà họ thả okay. I got to I mean mental help you. Tự nhiên mua mà và đừng mua họ baseline mình tao tôi xin lý cho nên là right. So trên được chưa có chủ việc tụ là chưa. That's one term that I learned from my grandpa. Có thể nên là gì? Có thể gì có hậu nên là chưa có hậu nên. So it's all about control. You bông lọt đã rồi mình help take control.
Từ trong mà 그 보존시에 그때 차 명령을 인터셉트와 color presentation auto paper better more awareness and digital as a whole. 자기 어린이와 저 시설자 분홍과 그런 또 열린 진행하는 금방 그 experience of 그 진행 연맹이 원래 하는 또 반대가 그 리몬 시간이야. có bỏ từ với sao hơn là với từ chính mình nên là không có bỏ theo là mỗi cái impact to cái môn của họ và
So it does. The region they used to more called the study talk. I forgot about it. Đi cái này cái mà thuộc especially có một cái hôm nay episode đó, có một họ where yeah, you more beside the bipolar one, more time will take two. You có những cái họ top P episode đó. Vừa cái này cái gì là cho kiến chứng đó, it help write down. Thì lỡ thêm more họ là the 12 step, right? 12 step nó mà là chỉ for đi mình cả đi chỉ cái church đó. Chỉ là more 12 step for drug and alcohol. Thì là more 12 step for mental health sao? So nó mua linh đỡ đó, biết không? Chỉ thuộc chỉ có kiến chứng vì cái chất kiến chứng nó mà do họ phải use họ comfort với tự sao. But giờ thuộc có kiến chứng nên nếu họ comfort nó có nó chỉ help write you down too, and help to stabilize you too. And what you don't you can do you bought you value can too. So that's what I'm saying. Cái này cái gì nó this the time we what that ít tụi nhỏ nó muốn tụi so much hardship nó. Nó nên khó tả tụi nhỏ cái lọ kia lại tụi nhỏ chú mua chịu right. Ngoài là chúng tôi đi bây giờ tôi cho mọi anh la được thành nhau tôi thấy nó một thay một bộ lại được chuyện không nhẹ được tốt cho thế đi bây giờ một đâu gì lo đâu cũng đi lo đâu ấy mình chỉ học distance của mình và bây anh la được thành cái chuyện nó và có món không đi lo nó đúng là ăn là nó nhiều gió nổi gió nó để lối dù ít trên nó để lối dù chỉ bóng sạch bóng nó 也个只开始二号哎呢，能都搞都摸的啊，我那时候还是了哎，有些都我能往上去。How concept that concept and that ideation of it. You cancel that off. So got you all on the more than the double or you walk create or some more schedule to go to more there, right? Was only what we do fidget in it. Con đâu trong quan niệm á, ấy hiểu chúng tôi rồi chúng tôi 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 thanh năng coiอยู่นะยังว่าtu DJ nên chỉ đi share thế nào, rồi còn chúng tôi sẽ chỉ nó share rồi để chỉ press rồi, ta chỉ ít chỗ cái gì nói, giờ tổng nó một cái này share được công kết tôi để nó con đâu quan niệm nó bây giờ coi cái gì, rồi thanh năng tôi khó có lại có khi cái đấy rồi, rồi còn lúc mình mòn nó có chỉ trả thì mình được share là sự, thì trong này là như họ concept, but it's something that you don't see but it actually driven. Học qua hai cho nên là sự cái này chỉ là same thing. Bây giờ kiến chứng là cái này ví dụ như các sĩ gì ba cái vấn đề, các tổng đề, giờ tôi explain cho tôi sau là cái nên cái gì, cái này chỉ là học cái gì, right? Cái ba cái tự do rất cái trọng độ.
So 이제 영화에 들어오는 연사의 대화가 이렇게 나요. quindi ti sai c'è 오늘 느낌 더 못하냐 그 사람들 ti 외가
So I would say chỉ có sĩ y họ là thế bây giờ luôn nó cứ sĩ ở họ rồi yeah bây giờ chuyển chân là chỉ một sai thế ta thế mù tông gì mù cái professional help this is I have a same case like this in Cover County. This is a 15-year-old girl, where she's happened the same thing. But it ended up to be misunderstandings, and it leads to be so big. How they create it, it's a misunderstanding where a school social worker mislead judge or mislead report, and it lead to something that becomes so big a family situation. Gia chỉ cần nói là cái những người mà cái mỗi tụi mình gia sản mỗi người có nên có số chế thì tụi mình sẽ số chế tụi mình sẽ nó qua thì bố hiện từ những số school gì là thằng số gì school social worker expect the ability yeah common it's and then lần gì chạy lần gì đi tụi đi thấy là lúc gì đi closure gì cost more. That became a really big thing until it came into my crisis team, and I got fed up and I started yelling. But yeah, and it was solved within 6 hours, and created 6 months ago. That was so big until Lindsay's in the whole chain. Child protection was all involved because no one listened to the girl, and no one listened to the dad. Because đơn giản là trai đơn giản là đơn giản mà gì, lần nhiều là đơn giản ông hiểu biết cụ sẽ chịu một cụ sẽ cụ gì mà ông ăn nó shut down thật đó, cụ hiểu bên đó. So because a lot of times you go so you should talk about, you go so you should train. Cái go chỉ cho đi yêu right? You want all you the ball, then well, so to be honest here. You have to do it. You have to know it first before you one mistake. But mistakes are lesson that you look good. You not go ball at them when you approach it. So, but you got your you have to you know search. There's a lot of mistakes out there, but you earn up to your mistake. Be willing to admit, oh, I'm wrong. Did you look or be willing to correct. That's the key of really moving on.
I want to add that you both did can you share anything though? I would say these resources, share these resources because yeah, you could be they can share with your friend, with your family, they're not professionals. There's no more training, I didn't mention the best thing is give them the resources, but it's really hard for them to sometimes you know to even like
take that, that advice to reach out to that resource. So, but it's good to at least share, let them know about it. That where actually you can try that you're seeking these resources, or because like for me, like a lot of people out there, oh, come and do another no shit. Like, but I'm like, but to me, it's good because like when you do another no shit, it's not bad. It's just that when people take no shit, you feel better, So it's kind of like continue to provide these resources because again, you're your friend, your family. There's a lot training that you buy you, that you tell you how to help you, because again, it's not something we talk about, or not everyone has that mental health training or that awareness. So I feel like again, what you're trying to do, and what you're like, it starts with you because being here is you doing something. It starts with you. Do you have something?
Can I finish one? This is my last message. Speaker, we're so much into their professional, right? No. For me, I see differently. I think it's they're professional in no way, right? 你喺度解你都會做夢啦，你這解更高嚟嘅。The way 你解啦，比起你往靠，比起你嘛係 OK， 你只係都能 professional， 你係 professional。No, people person problems, right? People person 都能 people person 的chuyện，真的 challenge the professional 啊。Yeah. So when people say, oh, it's not professional, that right now, it don't ring a good bell in my ear because a lot of professionals do what's wrong. You sure I know that? Especially you step into really professional fields. A lot of professionals now make a lot of assumptions that is not correct, especially in the mental health field. So, what you feel comfortable is, start with you. What you feel comfortable is, professional is good, but because at the end of the day now, know yourself first. Okay? Maybe get it you high spend right? Cũng trong mental health có thể cũ giờ, cũng trong mental health nó cũng lấy một tan cho này, cũng tôi nói thôi mình biết chỉ sẽ rồi. So we cannot just say just straight up mental health. No, I'll say whatever works for you. Yeah, từ bắt đầu có một mùa nữa, try both. Ôn nên chỉ hỏi correct của sự. Yeah. Even work with mental health field where people had their, oh, you have to no matter what's the mental health person. No, I don't do that. Because I saw firsthand, no, it don't work like that. Everyone's different. So whatever works for you, know yourself, use that, it will guide you. Yeah? Sorry, I took too much long time.
I want to also add to that.
Can I wrap that?
Yeah, go feel there for music, mental health on the outside Western medicine, which is music the professional. And then for me, even when you they could feel better too. But that's just me because I grew up with that. I grew up with, we used to, so there was a kid who feel like, yeah, I feel good. Like, people feel good. And then we also, the Mika side, go seek this professional help. And then if I have like that bridge where my parents also understand, my mental health, and then also then it goes hand in hand, and I feel like really good.
We need to bring all the elders
and so I do feel like, to me, we want your shaman, you have professional help, but they're professional on the, to me, shaman, there's a spiritual side for me. But again, maybe
thank you, everyone.
If you guys can share this, also slide with us.
Oh, yeah. I have more resources, sorry.
我想昨天做的那群啊，都同Lo-Pha Society 談咗就好，因為我呢個嘢，從那呢，都周末睇下呢個群出來去。
Or any last questions before we end as well?
Your name of question, the name of question that she gave, Lo-Pha Society, la 投訴啦，同呢班護者嘅。Feel free to talk to someone in chat before you guys get up. She was I talking to next the nature there's almost pay the donor your sponsor Lula Tangi on 85th in Broken Park. So talk the name of Tella or Hmong look look forward to some of our future workshops, and we appreciate your patience with us. You know, this is our first workshop, so we're still learning how we can make this better for the community and for everyone here. 그렇죠. 좀 멀론 데서. Yeah, okay, what's wrong?
Thank you everyone for coming.